all the speakers
I'm
on
not
the...
done, eh?
Yes,
I'm
are you?
done.
No, today I'm giving you 100 over 100.
No, good morning once again. I just wanted to, I know people are like me, a bit sensitive if you misspell their names. Bishop of the Catholics is not Palani, it's Palani.
Palani. Okay.
Yes.
Thank you, Minister. Heidi. Heidi.
Good morning.
Good morning. Okay. So,
Good morning.
thank you.
I can hear you. Yes, thank you.
Thank you. Who else? Hi, patients. SABC. I don't think it's live. Let me find out from Uvi. I don't know. Okay. Uvi, where?
Hi, Ma.
The SABC wants to know if this will be on your Facebook or Twitter. Will it be live streaming?
No.
Okay.
Mabato.
Hi, Shannon.
Hi, ma'am. On that one, we do expect a couple of media people in the room.
Yeah.
We've been indicated that that a few journalists would like to join us. So
yeah,
we are unable to stream this to our account, but if they wish to join, then they can obviously join in on the session. I think they're asking for the purpose of carrying it live, which I'm not sure if so I think they should just join in. Yeah.
All right.
Yeah, it's not something we had planned for or prepared the program around. So
okay.
Yeah.
I just want to see if I've got all my speakers. We'll start. Everybody else will join as and when we come, as they come. Minister is here. Joyce is here. Hyde is here.
Shongwe.
Minister?
Your other program director.
I'm trying to see, is Anne here? Not yet. WHO, are you in? Dr. Owen Kalua? No. Richard Matopoulos? Not yet. I saw Dr. David Harrison.
Yes, I'm there. Thank you very much.
Thank you. Mr. Joseph Masilo. No. Major General Bafana Linda. And they will join as they will miss the minister's speech once we start. As we start. Okay, just give him a minute. It says 9:58, so we've got 2 minutes. Please, if you are able to call and tell the speakers we are starting, that time for us is critical. which means what?
Good morning, Minister.
You want me to
Minister,
start?
colleagues, can you guide me if I've got Minister indicated we spelled Palane incorrect? Is that now Pashlane?
Palani.
Palani with a PH, the rest is fine.
Thank you so much. Thank you so much for that. I'll make sure that's corrected now.
Thank you.
Shailen, please unmute Professor Keziah.
Professor Keziah, okay.
Yeah.
We'll do that. Thank you. Professor, you've been unmuted. Please, can you test your mic?
Good morning, everyone.
Good morning.
Good morning.
Okay,
I've been
thank
here
you.
since 2:45.
Oh, sorry. Sorry.
But at least I could hear the conversations.
Oh, okay.
Thank you.
Thank you.
Osmabata,
Hi, Shailen.
can we just indicate to the room for the purpose of the meeting, there are people who are joining who are not using their name and surname, but are using the password, are using the words anonymous. For protocol and for those in the meeting, we are going to remove you until you just rename yourself correctly. So if you can just, we do have a couple of people, not a number, a couple of people who have joined under, have not joined under the name, surname. And I just think for formality and the occasion.
Yeah.
Thank you. Yeah.
Thank you. Now, Richard Matsopoulos and Dr. Owen Kalua. I thought UN people are strict on time. Eh? Okay, we do have Newsroom Africa. Dr. Kalua is represented by Dr. Joseph Mwangi. Is he in, Dr. Joseph Mwangi? Okay, there is this Dr. Kibachio says he's muted. Look at the chat, Shailen.
I've made him a co-host now.
Okay.
Thank you. I'm here representing Dr.
Thank you. Where's N? Minister, we had such a terrible load shedding this morning, but now one of the stations in Pretoria East from 7 o'clock, the lights just came back. We were even worried that this thing will continue because there's a whole Pretoria East.
Wow.
Mm.
Good luck.
What's N? Good morning, everyone. Yes, any struggling to come in now? From your own account, please, we assist your boss. Look at the one on the email. Okay. We were just resent, please. Yes, I think we can start. And we're still struggling, but I think now that everybody is here, except we're still waiting for, who is Chandra? Oh, okay, okay. You can connect too. Okay, let me forward you an email, then you click on that email. Yeah, okay, all right, okay. I, 14. Yeah, okay. Job.
My apologies.
Welcome, man.
I think it's easier to get with the link than with the, because people are struggling to get in.
Yeah, mine was opening up in a link for the 26th for some reason.
Yeah. Okay.
Is that Dr. Mwangi? Yes, he's here.
Even our survivor is struggling, so I must just send the.
Robert, you're here, yes. Robert, are your people here?
Yes, they are.
We have Bishop is here, and Joseph is here.
Okay, good morning, everyone. While others are still struggling to join, but I think they will, with the link from the email, I think it's easier to use that one. So we will ensure that they get the link from the email. But we are starting. Charlene, can you just put the program on the screen? Thank you, Charlene. Yes, good morning, Minister. I will acknowledge people as I receive names of who has joined with us today. I know that we do have Nkosikazi Mhlauli from the Mhlauli who's joining us today. We've got CEOs of different companies that have joined us today. So we will acknowledge people as we go through the program to welcome them to this webinar that we are holding today as part of Women's Month, but also to really answer the question around gender-based violence in the country and see what we're doing. As a minister is the chairperson of the Interministerial Committee on Gender-Based Violence and Femicide. And with that, she is really a custodian of the National Strategic Plan on Gender-Based Violence and Femicide. And in the NSP, there are different interventions that must be implemented by South Africa as a whole. And for us to come to the no gender-based violence in our lifetime, we need to ensure that whatever program that is out there that seeks to address that, we implement that. Now, one of the drivers of gender-based violence that has been identified in the NSP, but in the past 2 months, we have seen a lot of reports that were linking violence and crime and alcohol abuse. So the Dr. David Harrison and a group of researchers and medical doctors wrote to the Speaker of Parliament to indicate this relationship between gender-based violence and alcohol abuse. And with the minister, we then said, let us have a webinar that is not going to be anecdotal information. Invite people who have done work, researchers who have done work in the area, to come and share with us so that we know what we are dealing with. So that each and everybody who is dealing with issues of gender-based violence that has a link with alcohol abuse, know how they are going to deal with this going forward, because we're talking from facts. Hence, we then went ahead and said, let's invite professors who have done the work, let's invite medical research council and WHO as an entity of the UN that is working also in the area of health, including alcohol abuse. Let them come and share with us, especially giving us the international perspective on how alcohol abuse contributes to gender-based violence. We have then invited also South African Police Service, especially Major General Bafana Linda, who is the head of the Family, Child and Safety Unit, who in a way they can say these are the response, people who see the impact of what alcohol does on crime and gender-based violence. We then invited AB in Bev to say, because this webinar today is looking at the impact of alcohol on crime and abuse as an industry, for them firstly to listen to what research is saying, but also to share with us on, after listening to this, how they can also assist to ensure that their product is not linked to gender-based violence, because we are not going to win the battle for gender-based violence if one of the drivers is not addressed. We then have Dr. David Harrison, also as part of the people who have worked in the area. And we invited a survivor who will share with us how every time her partner was drunk, she will end up in hospital. And then with the partnership that we have with UN Women, When women has the he for she program that they have with South African Catholic Bishop Conference that now works with taverns, men at the taverns. And I think it's such a very interesting model in what they're doing to ensure that they address issues of gender-based violence, but more than that, address issues of family, because these men who are in these taverns have families. So I think that will be a very interesting a discussion that we will learn from there. So I am this morning moderating with our partner, UN Women, Me and Githuku Shongwe, and we will be moderating the panel together. And unfortunately, because Women's Month is such a busy month, Anne has another engagement, so she will do the first part on the research side, and then I will look into the responses and interventions. And Minister also will be with us, I think, until half. She also has another meeting where she is going to be speaking. But we have a responsibility to come up with resolutions from this meeting that will contribute to programs that will intervene to stop, because our mandate is not to reduce gender-based violence. If you reduce it, you reduce for who? Is to completely eradicate gender-based violence in our lifetime. So I'm now going to give the opening and welcome is going to be done by Advocate Mikateko Joyce Maluleka, who is, we're still saying, our new Director General in the Department of Women, Youth and Persons with Disability. Joyce, the floor is yours. Madam Joyce?
Your mic is muted.
Unmute yourself. We're not muting you.
Yeah, finally, I unmuted myself. I'm in 2IR. Don't forget, I'm not yet in 4IR, I'm in 2IR. I was trying to unmute myself. Good morning, Minister. I will greet others after this. I think Me Ramakhoshi said it very well, that the webinar is for us to be able also to talk to those people or those institutions that sell alcohol, so that they listen and understand the impact of alcohol on gender-based violence. I think what we need to say is that it is not about the pocket, but it's a matter of life and death. The right to life is absolute. It's absolute. When you look at the dramatic decrease in violence and injustice following an alcohol sales ban in our country, it bears reference that alcohol contributes to gender-based violence. When alcohol was banned, alcohol sales was banned, gender-based violence decreased. And when you look at the fact that South Africa is among the countries with the highest rate of gender-based violence, despite the political will, unprecedented body of laws, and world-best model institution practice to address this scourge, you can see that there's something else, because the political will is there, the laws are there, the institutions are there. What else can our government do? Now it's about the private sector also doing something. You know that South Africa made it to the Guinness World Record in 2000 as being a rape capital. 20 years later, we're still going up. We're not even decreasing, we're still at it. I think something needs to be done. At the dawn of democracy and the introduction of our most celebrated constitution with its expansive Bill of Rights, women, youth, persons with disabilities, and the LGBTIQ+ thought their nemesis was defeated because the constitution will protect them from this scourge. However, violence continues against them unabated. And research has already indicated that there is a link between violence and alcohol. So this webinar gives us an opportunity, as Mabatu said, that it gives us an opportunity to dialogue on ways to curb this scourge that not only affects women, youth, and persons with disabilities, but also the economy of our country. As we dialogue, we need to know that our department's mandate is also to develop policy dialogue, directives, but also to indicate or to inform other departments to amend their legislation or to come up with measures to address violence. So whatever that we are going to agree on today or whatever is going to be suggested, it's not just in vain. As a department, we're going to take it forward. We are going to communicate with all the relevant departments that have a responsibility to address the scourge of violence in South Africa. Having said all this, I welcome you all. In my language, we say hoyo hoyo. Old age will know Sipho Mabuse's song, which said hoyo hoyo harare. It means welcome. I welcome you all. I welcome all honorable MPs amongst us, all distinguished guests, the panel members, all participants, civil society organizations that are here, public service officials, each and every person who's here. We, as a department, we are saying, feel free, participate in this discussion, also make inputs, make suggestions so that we can be able together move forward and eradicate the violence. As Mabatu has already said that we don't want to reduce, but we want to eradicate. We want South Africa to be, as General Beki, the Minister of Police, said that he wants to see a 17-year-old woman walking on the street at 7 p.m. with a cell phone, fearing nothing. That is exactly what we want to achieve in South Africa. Thank you.
Thank you very much, Joyce. I think we all feel welcome, even in our own spaces, in our homes, because of the lockdown. Minister, I have an apology from the UN resident coordinator, Mebekele Thomas, or due to load shedding, she cannot join. So she wants us to convey her apology to you. So with that apology, we now give ministers the opportunity to set the scene, to really talk to us about the topic we are addressing today. Minister, the floor is yours.
Well, program directors, good morning. Honorable ministers present, honorable members of parliament, Director General of the department, distinguished panelists. I'm happy you have my bishop amongst them here, Bishop Palani, representatives of the civil society, traditional leaders and healers, faith-based organizations and business sector. Dumelang, good morning, and happy Women's Month. I'm so grateful that you have joined us today to contribute to eradication of this stubborn pandemic of gender-based violence and femicide that we face on a daily basis. For us, every day is an opportunity to redouble our efforts to tackle this pandemic, because the responsibility of the mandate of the department, as the DG had said earlier on, is not only about fighting gender-based violence and femicide, it's also to the most urgent now is access to finance by women so that they cut the queue of those who receive food parcels, particularly able-bodied thinking women whose dignity is reduced because they do not get access to finance. Now, as a nation, we also, while fighting the invisible pandemic called COVID-19, a highly visible pandemic of gender-based violence and femicide continue to ravage women and children, unfortunately also in their homes. Statistics show that South Africa is one of the most violent places in the world, and that femicide in our country is 5 times higher than the global average. At the same time, it is reported that the use of alcohol in South Africa is among the highest on the African continent and in the world. The National Strategic Plan on Gender-Based Violence and Femicide, which is approved by our cabinet, highlights a number of drivers of gender-based violence and femicide. In this regard, the abuse of alcohol is one of the main drivers of this pandemic. It is against this background that we went to focus on alcohol abuse, and we continue our resolve to eradicate gender-based violence and femicide. Program Director, alcohol abuse has a huge impact on users, their families, and their communities, resulting in a number of social, psychological, and economic ills. These ills have a bearing on this family unit, health systems, education, and community relations. Moreover, alcohol abuse, I emphasize abuse, places an increased financial burden on the individual and family, destabilizing the family unit and affecting the very social fabric of our society. The South African Police Services has previously noted that alcohol abuse is often at the heart of the so-called contact crimes. These include murder, attempted murder, sexual offenses, and common assault. In addition, the nexus between alcohol abuse and gender-based violence and femicide should not be underestimated. Indeed, alcohol abuse transcends racial, class, gender divides, and affects all areas of our lives. This sad reality points to the fact that the problem is far-reaching and deeply entrenched. This challenge also adds to the delay in us participating fully in generation equality. We want to be counted. We do not want to wait for 200 years before women reach globally that goal, with South African women counted amongst them. For South African women have been freedom fighters and have been at the forefront of the battlefield during the difficult days. Ladies and gentlemen, I will not talk statistics in relation to the link between gender-based violence and femicide and the abuse of alcohol. We have amongst our midst a panel respected panel of experts and those leaders who studied this phenomenon extensively, and they will share with us their own findings. I will, however, say I believe the entry point in dealing with gender-based violence and femicide and violence broadly is to address that which drives it, that which enables it to thrive. If alcohol abuse is one of those drivers, as the National Strategic Plan has indicated, then we need to address alcohol abuse together, as we have all the experts with us today. Therefore, this webinar is timely. We are here today to continue to find ways to break through this deeply entrenched problem that threatens the livelihoods of this nation. The webinar provides a platform to engage each other on the reality and hold hands to curb this deadly phenomenon. We want to tackle the problem head on and move towards identifying interventions that will bring an end to this and change the outlook of our nation. We hope that this will shape our society towards the situation we can all be very proud of. Distinguished colleagues, you will recall that during alert level 5 and 4, our government implemented a suspension of sales of alcohol as part of efforts to mitigate the efforts of fighting COVID-19 pandemic. During that period, we witnessed a significant decrease of trauma admissions in hospitals and admissions related to alcohol. We are also aware that since the lifting of the suspension of the sale of alcohol on the 1st of June, at least 29 women within that month were brutally killed. In addition, murder increased from 20 cases in one day to 40 on the other cases on that month only. Subsequently to the reintroduction of the suspension of the sale of alcohol sales, there have been mixed responses. On the one hand, survivors of gender-based violence and femicide who for a while experience some form of safety because their partners did not have access to alcohol and were not violent. On the other hand, business people raised issues of job losses, which is so real, as their business depend on selling alcohol. Ladies and gentlemen, now that the suspension of the sale of alcohol has been lifted again, we, with some restrictions attached to it, we continue to be concerned about the impact of this on violence, specifically gender-based violence and femicide. We therefore have invited experts today to share with us their researches and findings on the link between alcohol and gender-based violence and femicide. We have insights as we implement National Strategic Plan on Gender-Based Violence and Femicide. I believe that in order to eradicate gender-based violence and femicide in our lifetime, and that women joining others in generation equality in our lifetime, we must implement programs that aim to change the behavior of the perpetrator. Let us all join hands to play our part in implementing the key programs in the 6 pillars of the National Strategic Plan on Gender-Based Violence and Femicide. While we are all struggling to live the new normal with this pandemic that we cannot see with our own eyes, I appeal to the leaders in the room to continue appealing to communities outside that we must continue to observe the World Health Organization protocol of keeping a distance, of washing our hands and sanitizing as often as we possibly can. It stops with us. Unity in doing the right things is in our hands. The time is now. I thank you.
Thank you very much, Minister, for your inputs. I think we have all heard what the Minister is saying, and definitely we all are looking forward to the presentations from our panel of experts, so that whatever we're doing going forward is informed by research. And Minister, I think what is even critical for us to have this webinar today and this weekend only, the number of accidents that are linked to alcohol abuse and leading to deaths are shocking. So I think we need, as a country, definitely address the issue of alcohol abuse, because it leaves so many people in pain. In China, only the 3 policemen who were killed by a drunken driver. And those are realities that we're facing, and we have not engaged in those dialogues. So I think this gives us an opportunity to engage in that dialogue. I see, Minister, we have the Chief Whip in our midst, Mepemi Majodini. We welcome her also in the webinar. And now I'm going to give to Me, you're welcome. I'm now going to give to my co-host, co-moderator, Me and Gituku Shongwe, to moderate the first part, as she is going to be able to leave earlier on, and I will do the second part. And
thank you so much, Sis Mabatu, for that introduction and for the beginning. Minister, wonderful to see you again. We really are meeting often. I'm loving this online. At least we get to see each other more often than we would if we were not physically searching, running up and down, trying to see each other. So it's wonderful to see you, and congratulations for leading this work. I also want to acknowledge all those who are present with us today, including our new DG, who will not be new very soon, but we still acknowledge you as our new DG. And I just want to welcome, I see there's many activists on board with us who have been soldiering on this work for a long time. This next panel, the first panel we're going to focus on the data and on the research. We need to understand exactly where we stand and why it is that we find ourselves here, and what are some of the opportunities that we have for some real action. And I want to just start by saying that this issue of gender-based violence, you will have seen that even within the UN, the Secretary General of the United Nations himself has actually highlighted the issue of gender-based violence and during this COVID period, and how it's been exacerbated by, we've been calling it the shadow pandemic, but how it's been exacerbated by multiple factors during this time. One of them has been the issue of alcohol and substance abuse. And I think the other big point I want to make without making a big speech is to say that we know very well from a lot of the research that we've done around this work, the work that we do on a day-to-day basis, that the issue of norms and stereotypes, we will repeat this continuously, the issue of social norms and stereotype remains a big issue in terms of the perpetuation of gender-based violence. One of the things that we want to really start to address, and there's been a big debate going on, is alcohol a cause or is it an excuse? Mm-hmm. Is alcohol the reason that men abuse, or is alcohol the fuel to conduct behavior that is already entrenched? And is there a way to actually explore managing alcohol? Is there a way to rethink this? And I mean, we've been seeing and we know from our partners, and I'm hoping my colleague, Dr. Mwangi, who will be joining us shortly from WHO, will share some of these examples. We know from across the world, and I think Australia is used as a very strong example, where there is actual control of the amount of alcohol that can be consumed by a single individual per week. Obviously, the issue of how do you account for this in the household is a difficult one, but there's been huge investments in how alcohol is consumed. What are the regulations around how alcohol is distributed? The people who are responsible for distributing alcohol are trained to do so. But I think, we'll hear from the experts, but the key thing we want to find out from this first panel, tell us what is the state of play? Because we are having this debate. Is alcohol a cause? Is alcohol a driver? Is it something that just enhances behavior? What is the research telling us? And to talk to us, we have a panel of three that we're going to start with now. Three speakers we have from the MRC. We have Dr. Richard Matzopoulos with us. He's an epidemiologist and specialist scientist from the MRC. And we saw the eruption that happened and the data that was coming out of Cape Town. He's also an honorary research associate at the University of Cape Town School of Public Health and Family Medicine. He chairs the Injury Prevention Working Group, a transversal structure within the Western Cape government that seeks to reduce the burden of injury in the province. Dr. Richard, we heard from some of the hospitals in the Western Cape around the just horror one day after the release or announcement of alcohol, the return to alcohol, the permission to purchase alcohol. We heard that hospitals had, every single patient in the hospital was linked to alcohol abuse in one way or the other. So looking forward to hearing from you. We're going to hear from Professor Kezia Batasai. Professor Kezia Batasai is an associate professor of sociology. She researches extensively about gender, sexuality, health, and health systems. She's a member of the International Sociological Association that looks at these issues of clinical sociology, women in society, gender studies, HIV/AIDS, health policy, including this issue of alcohol. And then we have with us from the World Health Organization, Dr. Kiwashio Joseph Mwangi, who actually has just taken his position. He comes from Kenya, and he's been the head of the Division of Non-Communicable Diseases in Kenya, and has been running this work with a background from the London School of Hygiene and Tropical Medicine in the field of epidemiology, and has been known for leading a lot of significant work in this area. Dr. Mwangi, we are very excited to have you here and to understand the impact and of policy. How do we, what can we learn about gender-based violence, and how can we prevent the impact that we see it having on, alcohol, the impact that it has on gender-based violence? So I'll start with you from the MRC. I'll start with you, Dr. Richard. Let me see, I'm not seeing you on here. Are you here? Is Dr. Richard with us? Yes, you are. There you are. Wonderful. Okay. So welcome. Let's start with you, and then we'll go to Dr. Kezia, and then we'll have Dr. Mwangi. Give us just, give us we'll unmute you in a second. Just give us an introduction. Give us, your comments. Then I'll follow up with a question and just see if we can probe a little bit. Over to you, Dr. Richard. Are you able to unmute?
Shalen, I think, can you please unmute Dr. Richard Matopoulos? Uviwe?
Yes, yes.
Please.
Uviwe? Can we unmute?
Unmute Dr. Richard Matopoulos.
Okay, I think I have sound. Thank you very much. It would have been a very boring presentation otherwise.
Wonderful. Over to you.
Right, thank you very much. Good morning, Minister, colleagues. I'm not sure exactly who's participating, so let me just say all protocol observed. I have a presentation ready. I wasn't quite clear on the brief, so I've prepared something on social and health impacts of alcohol. Would it be possible for me to share that with you, to share screen?
Yes, please. Yes, please.
Okay.
Go ahead.
Let me try this. Share screen. My screen sharing is disabled, so I think that needs to be enabled too via the
Uviwe and
admin,
Shalen, please release the. Can you give? I'm checking
Richard, I think
whether.
I've done that.
No,
Okay,
he doesn't
thank you.
have. Do you have it? No,
right,
he needs.
let me try again.
I
Yes,
don't see
okay.
him. Okay, he's fine now. Okay.
I've got it, thank you. Let me find my screen. There we go. I also should check, how much time would you like me to speak for? I wasn't given a very clear brief.
Okay, I think 10 minutes would be good.
Okay, 10 minutes.
Yeah.
Then I'm going to go rather quickly. I've got quite a lot to get through, but I'll give you broad brush strokes. And I wasn't sure David Harrison was going to be presenting before me. I see things have shuffled around, so I'm going to go through aspects that he will cover later, I think, very quickly.
Okay, yeah, we decided we're going to split this up into 2 panels because it's a lot of time and we want to give ourselves enough time. So we thought, let's start out with some of the data. And then we will take a look at that. Of course, what we would like is to focus a lot on the impacts of alcohol on GBV. That would be very useful.
Certainly.
Thank you. All right.
Right. So unfortunately, it's not particularly data heavy, but there is some. So let me just start off. I wanted to give you an idea of why we focus on alcohol as a particularly important condition needing intervention, not just for interpersonal violence and gender-based violence, but we know that there are more than 100 conditions that are associated with alcohol use. So part of the work that we do in the Burden of Disease research unit is try to pick apart what the contribution of alcohol is to a whole range of diseases. I'm not going to go through this in too much detail, but just to give you an example from the Western Cape, these are the leading causes of mortality in the Western Cape, where we're showing years of life lost. In order, you can see HIV at the top. Homicide is in fact second. The numbers are a little bit dated, but you can see how alcohol contributes to most of the leading causes of the disease burden. All right, here's a very complicated looking formula. I won't be asking questions about this at the end of the presentation, but I just wanted to point out how we go about doing this work roughly. There's a mathematical formula, and what we look at the bottom right is we look at consumption amongst drinkers, and we look at the prevalence of drinkers in society, and then to the left, at the bottom left, you can see there are a whole range of conditions. And for each of those, we look at a risk curve. So depending on your drinking pattern, we apportion a certain amount of the risk from alcohol for each of those different disease categories. Right. I'm not quite, yeah, here we go, sorry. All right, so more complicated formulas. Again, we don't need to know too much about these, but if you look at the bottom, you can see the prevalence of current drinker, the prevalence of the binge drinker, and the average consumption per day amongst current drinkers. Sorry, amongst current drinkers is what goes into the calculation. There's a different calculation for chronic conditions and non-chronic conditions, the things that happen immediately. So we've been particularly interested in this with the alcohol ban, for example, road injuries or interpersonal violence. And because of the topic today, this is the risk curve for interpersonal violence. You can see binge drinkers are in the middle, and there's a dramatic increase in your risk of being a victim of interpersonal violence if you engage in binge drinking. If you drink moderately, you can see there's a very small increase in relative risk by way of example. So the big difference for these acute conditions happens with a pattern of heavy drinking, which is very typical in South Africa. In terms of the overall contributions, you can see this is how it stacks up. It's a mix of communicable diseases, but the single biggest cause, communicable and non-communicable, and injuries. So the biggest single cause is intentional injuries or violence is the single biggest contributor. You can see that HIV and tuberculosis and unintentional injuries also contribute, in fact, together about 3/4 of the injury burden from alcohol. It's important to understand that there's what we call a bi-directional relationship between violence, mental health, and alcohol misuse. So let's just look at the alcohol violence nexus. If you are engaged in violence, or if you suffer or are a victim of violence, you're more likely to drink alcohol as a response and to increase your alcohol intake. Also, if you're drinking more alcohol, it's putting you at increased risk for violence. So these things work in both directions. Similarly with alcohol misuse and mental health, the more you, if you're feeling depressed, you're more likely to drink. The more you drink, the more likely you are to feel depressed. So there's a vicious circle, and they're bi-directional relationships between these three very important risk factors which lead to violence. Okay. This is probably the most data heavy slide, and I thought it's important to recognize that this pattern of drinking happens particularly on weekends. So you can see that this is, I don't know why it starts on Friday, but this is Friday through to Thursday. We're looking at all the homicides in the Western Cape, and we're looking at alcohol relatedness of the deaths, which are the red bar, versus cases that are sober, which is the blue part of the bar. And you can see there's a tremendous increase on weekends, on Saturdays and Sundays, and particularly late at night, which coincides with when people are drinking. So how does alcohol affect behavior? Firstly, alcohol makes you very emotional. It lowers your inhibitions. It makes you irrational. And very importantly, it also makes you vulnerable. So even if you're not the person engaged in violence or being the aggressor, you'll also become very vulnerable to violence because you are unable to respond adequately, or you're a likely victim for violence. So there are many ways that alcohol affects behavior that leads to an increase in violence. And part of that is really the psychoactive effects of alcohol, which is essentially a drug. It affects the central nervous system, it affects the body, and it affects performance. I don't need to go through all of these, but I mean, if we start at the top at a low alcohol level, you can see the mild sense of elation and relaxation and pleasure, that nice feeling after a drink or two. But as it progresses, there are a whole range of effects that, including slurred speech after about 6 to 8 drinks, but eventually you can die from alcohol poisoning after drinking too much of it. So these are very carefully calibrated, and this is what is used in calculations for things like drunk driving or operating heavy machinery to set limits. We did a costing study a few years ago. I'm not going to go into this in much detail, but just to say that we measured a range of different effects. The chart at the bottom is also possibly quite important, and that shows the effects of alcohol compared to other drugs. Alcohol is the bar to the far left. And the difference between alcohol and other drugs is alcohol imposes much more harm on other people, the red part of the bar, than to the user themselves. So heroin is the next bar. You can see a disproportionate, well, a higher amount of the harm accrues to the user, whereas for alcohol, the red part is the harm accorded to other people. So in doing our costing calculations, we need to look at the impact of alcohol, not just on the user, but on broader society, which is where most of these costs arise. I believe David is going to present some of this later, so I don't want to dwell on this particular slide, but just to say that alcohol costs government more than government gains in terms of tax and excise. And in terms of cost to society, alcohol imposes much more cost on society than we gain from it through employment and livelihoods. And I think that can be quite clearly set out. I'm not going to deal with that in too much detail. I'm also going to go through some of these quite quickly because I think David is going to repeat aspects later on when we look at solutions. But the question is, how do we intervene? And WHO has a list of strategies, and there are many of them, but we do know what works. And there's a basket that we should be trying to apply locally too. The most important thing is intervention is to reduce consumption, so reducing the demand and reducing the supply. I'm not going to go through details except to pause at this slide, which shows an example from a municipality in Brazil called Diadema. There are several other examples from around the world, but this was the impact of an intervention to change closing times and to reduce the supply of alcohol. And there was a 44% decrease in murders corresponding to the implementation of that law. And I think that's probably quite similar to what we've experienced during lockdown with this dramatic decline through reducing access to alcohol. Let me move on a little bit. I wanted to speak briefly about conflicts of interest. I note that representatives of the industry are in the meeting today, and I think it's important to recognize that there are conflicts in engaging with researchers who should be objective and industry who obviously have a vested interest in selling alcohol. And we see conflicts of interest even at a local level. So this is a school in Khayelitsha where we did field work, and there's a pub cafe assisting with an HIV intervention program. With all due respect, even if we look at senior members of government, you can see that even the list of commissioners in the National Planning Commission, there's several that have links that I know of with the liquor industry previously, maybe not maintained today, but present at the time. In the Western Cape, we see that several initiatives have been influenced by liquor industry, including the alcohol prevention game changer in the province, which went into partnership with the liquor industry. And all of these are questionable in the sense that they move us away from the best best buys for violence prevention initiatives and for alcohol control. So one of the questions we ask as researchers is, how do we manage conflicts of interest? The WHO has a position on this. They don't engage with the alcohol industry when developing alcohol policy or implementing public health measures. And the interaction with the industry should not lead to imply a partnership or collaboration. And we need to take a leaf out of their book, as far as I'm concerned. As researchers, we make sure that industry money is always at arm's length from us, so we never take money from the industry directly. And we also maintain that industry shouldn't be able to influence the scope and methods and results of our research, which is very important. I think my final slide, sorry, I've got a minute over, but I have tried to make it as quick as possible. Ahead of the discussion about solutions, I just want to make us all wary of industry self-regulation and responsible drinking distractions. If you look at the chart, this is an article where they looked at revenue streams from alcohol sales and drinking in the UK. And you can see that most of the industry revenue comes from hazardous and harmful drinking practices. So whereas you've got 59% of the population are moderate drinkers, they only contribute 32% to the industry profits. Most of the profits, 60 to 70% of those profits come from harmful and hazardous drinkers. So the industry currently has a dependence on this drinking pattern. And if we hear about responsible drinking initiatives, we need to recognize that it's not affordable to the industry. I think we saw that with a 3-month sales ban. That's just shedding perhaps 25% of the income, but responsible drinking would cause the industry to shed much more income. So I don't think there's a mandate from shareholders or from shareholders to forfeit or forego profits from this drinking pattern. And this, I think, is the reason that there's no support from the industry for initiatives to reduce consumption overall, which is essentially what we need to do. All right, I think I'll end it there. Thank you very much. I can take questions.
Wow.
Either now or
Thank
later.
you.
Thanks.
Thank you so much. This is really very, very useful, and I love the categories that you've shared with us. I'm so sorry that we had to rush you so much, but those formulas were not so easy for all of us. But I think the summary for what they actually expose is very useful. Really appreciate the issue about the cost. Because the opportunity cost, I think, is a very important discussion to have. And I think when you hear from our, we have this UN Women and the Catholic Bishops conference, we have this program in the taverns. And you'll hear about some of this issue around the limitation of hours and some of what the impact is from some of that experience. And then I like the point about the conflict of interest, and it is a tough one, because I know that many industry partners have tried to be really active, and it's good to raise it so that we can actually pay attention to what the implications of that are. But we'll have questions in a bit. So let me ask Dr. Kezia to come on and give her perspective, having had this experience. And then after we have her and Dr. Mwangi, then we'll have a chance to have a discussion. So please, if you have questions, prepare the questions. You can put them in the chat if you don't want to raise your hand, but it would be good to help me with that. Shalon, if you can help me track any questions that come up, people can start putting questions in the chat. We'll take about 4 or 5 hands, but if we have them in the chat, we can take more. Over to you, Dr. Kezia. Are you unmuted? There you are. Good to see you, my dear. How are you?
I'm getting to you. Thank you so much, Anne.
All right, then. Go ahead.
Right. Good morning, Minister, once again, and everyone participating. My name is Kezia Batisai. I'm a professor of sociology at the University of Johannesburg, and I've been involved in gender-related research, looking at gender-based violence, alcohol consumption, and its impact on society, and also its influence on the challenge with gender-based violence and femicide in the country. And some of the work that I've done includes the He for She UN Women Project, the Johannesburg City Parks and Zoo, safe public spaces, trying to explore the issues of gender-based violence and the reasoning behind unsafe public spaces within our societies, and also work with the Southern African Catholic Bishops Conference on gender-based violence as well. So this is where I'll be drawing my presentation from, and some of the insights and the suggestions about how to proceed and how to tackle the issue of gender-based violence and femicide in the country. And I have prepared some slides, and I have to acknowledge that some of the information, background information, speaks to what Dr. Richard has spoken to, because we draw on existing data as well to paint a picture of what exactly is the challenge in terms of the interplay between gender-based violence, the medical issues, and health-related costs of alcohol consumption. And I'll be sharing a screen of my presentation that speaks to some of the findings thus far. Right. So from the findings that I gathered over the course of the years, you would find that there are challenges and drivers that are central to the gender-based violence issue. And we found out that predominantly there's a culture of drinking in communities, as everyone else knows. And the participants in many researches attributed the challenge of gender-based violence and alcohol consumption to lack of implementation of municipal bylaws and lack of awareness of those laws as well. What are these laws and what role do they play in trying to curb the issue of alcohol consumption? And also the issue of inadequate and corrupt law enforcement agents. This is something that came out of the research, and the participants highlighted that there is a challenge with law enforcement. Yes, there are legal frameworks that are in place, but when it comes to implementation, this is hampered or hindered by the law enforcement agents themselves, who are sort of corrupt and they do not do their work appropriately. And then there's the issue of lack of cooperation and collaborative efforts between municipalities and communities. So people are operating in silos, and you find that the municipalities have their structures in place and communities have the problem at hand. Why not come together and cooperate and have collaborative efforts that allow those communities rather to have an adequate appreciation of the laws that exist and the extent to which they can be implemented, and the role of the community can also be emphasized. And then there's the issue of the culture of proving masculinities and financial ability. The men and these researchers actually attributed violence and alcohol consumption to the culture, and in the beginning of this panel acknowledged the role of social norms and stereotypes. And these are some of the issues that are emerging from the researchers across the country. You find that men are under pressure to prove their masculinities and their financial ability. So on one hand, there's a man who has money. He wants to prove to his colleagues that I am moneyed and I'm in a position to buy beer, to consume, and also to extend the gift of buying beer to the women, for example, in the tavern. So there's the issue of those who have money and they want to exercise their ability. But also at the same time, when it comes to violence, the financial ability is on the contrary, because you find that there are men rather who do not have money. In the absence of that money, how then do they prove their masculinities? It's through violence. They become violent. They can't provide to the family. They can't provide for their spouses, their partners. So in the absence of the financial ability, they tend to violence to prove their masculinities and assert who they are as men. So this is something that came out strongly with respect to the perpetuation of gender-based violence within societies, the issue of culture and the need to be felt and be, known as a man who's in charge, who's capable and in a position to provide. And then the issue of unemployment.
Could you please project your slides? Put it in the, just project. We can see them, but we see them in it's not in the slideshow format.
Is it now okay?
Yes, it's now
all
okay.
Right. Thank you, Anne.
Right.
So I'd highlighted the issue of the culture of trying to prove one's masculinity and also the financial muscle, both its absence and its presence. So there are those who have and those who do not have. In the absence of money, they tend to violence to cover and make up for the absence of money. And in addition to this, there was the issue of unemployment and idleness in communities. People said we are idle. For example, in a community in Klerksdorp, they say this is a former mining town. There's no employment, we've got nothing to do here. So what do we do in the absence of employment? We end up roaming up and down the streets without anything to do, not to justify. They said we are not justifying the evil act of violence, but we are saying we resort to alcohol consumption as something that will pass our time and entertain us in the absence of real and meaningful engagement. And then when I looked at university students, for example, they say there's academic pressure. There's a lot of pressure that comes with just being a student, and they resort to alcohol to deal with that pressure as well. So this is something that speaks to higher education and the moments of idleness within universities, and also the lack of guidance of youth in communities and first-year university students. So one is new to the university space, and maybe they come from the Eastern Cape, they found themselves all of a sudden in Gauteng, where there's no family structure or support. What do? They resort to alcohol consumption. They form groups, they have peers, they go out at night and they consume alcohol. So all these factors are speaking to the culture of drinking, what actually drives this culture. So these are some of the factors that emerged from the research that I did. And also lack or no primary support or risk patterns from communities and families and universities. So the participants actually acknowledge that sometimes you have a problem and it takes a village to raise a man or a child, but the problem here is there's no support structure within communities or even families. Rather, there's stigma associated or attached to those who are struggling with alcohol consumption. Why not come up with structures or support structures that curb the problem? So I'm hinting at some of the recommendations that emerged. And then also on the effects of these challenges, there's the long opening and closing times of taverns. This is a very serious problem when it comes to taverns, especially in this moment when we are in lockdown and the ban has been lifted. There's a challenge of opening and closing times. So the tavern owners and the patrons actually say that at the end of the day, it becomes a regulation that is posted in taverns, but it doesn't make any sense. So the taverns operate anyhow. The closing times do not govern the taverns. So that's a challenge as well when it comes to implementation of these regulations. And then the sale of and consumption of alcohol by minors. This was something very problematic from the findings because they said minors are consuming alcohol in our communities. The taverns are in close proximity to schools and churches, but also the issue of churches is another discussion for another day because they said what was implemented first. Was it a tavern that was approved or a church that mushroomed on its own after a tavern was established? So they called government and municipalities to look into the location of schools, the location of churches. If there are churches that are not regulated or churches that are not approved in terms of zoning, please look into this because now we are not operating. These are the tavern owners now who are complaining and saying, yes, we know the rules that are in place, but also the churches are complaining, the communities are complaining about our location, but we existed before the churches. So this is something that also emerged. And then the drinking in public spaces on the streets, they say that this is something that is quite common. It's not abnormal for someone to drink from the streets or on the streets. So this also speaks to lack of law enforcement and then high rates of crime and violence. They said you can't walk around the streets. Like someone said in the beginning that Minister Cele is hoping for a society where a woman can walk after hours freely and confidently without fear of being mugged or violated in our communities. And this also speaks to public spaces within our cities. For example, the city of Johannesburg, can we have spaces where people are free to move without fear of crime and violence? And then poor to no implementation and violation of municipal laws, this I've already alluded to, and the corruption and bribery that undermine legal action. This is a serious issue. And then the effects, like Dr. Richard alluded to, these speak to risk sexual behaviors, high rates of gender-based violence, and sexual performance with partners, that these all issues contribute to the challenge with HIV and AIDS, and the lack of trust, infidelity, high rates of crime, I've already alluded to, and also antisocial behavior. You find that the partner is no longer eating at home or coming home very late, and there's the issue of disrespect. All these social aspects feed into gender-based violence. How then do we look into the social aspects that are related to alcohol consumption? One goes out to a tavern, drinks, but comes home very late, and the woman is just there. She has no right or power to voice and ask the man, where have you been? Or why are you coming home late? That's a source of tension on its own. So there are social issues that are central to gender-based violence, but also they are attributed to alcohol consumption. They acknowledge that the issue of social, challenges is really related to all these issues. And then there's the problem of mental and health issues. I wouldn't delve into this because I don't have statistics that speak to the mental issues, but it was an issue that was raised from the findings. And then I would also speak to some of the statistics that he made from the taverns, for example. And I've got two sides. The first side, I ask questions about how many hours you spend at a tavern per night or per visit. And some said 0 to 3 hours. So there was a group who actually said 0 to 3 hours. They spent 15 hours, sorry, they spent 0 to 3 hours, and these were 15 out of the participants. And then the other 35 actually said 4 hours to all night at the tavern. So in essence, you can realize that people spend more time at the tavern, and the more time they spend, the more they consume from the findings that I'm going to show you just now. And then also in terms of the other side, there are those who said 60% we spend at the tavern, and 60% of the participants rather spend 4 hours at the tavern, and 0 to 3 hours, it's 40% of the participants who spend that kind of time. So more than 50% of the participants spend quite a significant number of hours at a tavern from Monday to Friday. So this question catered for every day of the week, Monday to Sunday. And then alcohol consumption patterns. I ask questions about how many pints or quarts do you consume per visit, and 2 to 3 quarts. There were 10 people who said this, and 4 to 8 plus quarts, it's 40 participants saying that they consume that amount of alcohol. That actually indicates that there is a challenge with alcohol consumption, and the amount is quite worrisome. And then in another side, there were those who consume 4 to 12 beers plus, and these constituted 65%, and 35% of the participants consume 2 to 3 beers per night or per visit. Some, it starts, a day might start quite early, it doesn't necessarily have to be at night. So I also posed a very important question, having realized that there is this problem. I said, who then is responsible for ending gender-based violence and femicide? And this is a quite recent study. And this was in an effort to understand the role of stakeholders in the fight against the problem. So combined responses from Gauteng and the Western Cape indicate that 63% are of the opinion that it is the government's responsibility. 25% believe it is civil society, 3% assign the responsibility to the private sector, and 10% to the community. But then the question is, should we reduce this to government? Clearly the communities involved here, the participants who took part in the study, reduced the responsibility to government and municipalities without taking responsibility. Yet in these communities where individuals who are consuming alcohol are located, and this is consumption that has a strong correlation with gender-based violence. So it is worrisome when people push the responsibility of ending gender-based violence to the government. And also, this takes me to the structural level forces that we need to look into. And before I look at the structural level forces, I just want to highlight that from all these studies combined, there's a pattern that is emerging. We need to acknowledge the interplay between the structural levels, the individual levels, and community level indicators, because in essence, we are saying it is an individual who consumes alcohol, and it is an individual who commits gender-based violence. We are not blaming alcohol per se. Alcohol is not responsible. It doesn't rape a woman, for example, from the other slide that I saw, but it is a factor that contributes. It creates a conducive environment for gender-based violence because of the correlation between the two. So we need to understand the interplay between the structural, the community, and the individual if we are to end gender-based violence in our communities. Because at structural level, we are saying law enforcement agents are not doing their part. We need them to come on board, and we need to ensure that there's collaboration and eliminate all elements of corruption and ensure that we adhere to strict enforcement of municipal bylaws. And then also when it comes to—
One more minute, Kezia.
Right, thanks.
Okay.
When it comes to universities, communities, there's also need for collaborative efforts, because some of the university students were saying they're not even aware of the municipal bylaws. And in the absence of awareness, what are we doing? Someone continues to consume alcohol. And in a tavern context, the tavern owners are interested in money, which is reasonable in this context of, you know, economic crisis, but they continue to sell alcohol to people who are already wasted, as you hear from Joe from Klerksdorp. So there's a perpetual, you know, problem where you find that different stakeholders need to come together to ensure that we have an integrated approach that takes into account the different level indicators. And in the from the community level, government should also create employment opportunities. And this is something that cannot be done in isolation. Employment can be created, but remember, we acknowledge that people are consuming alcohol because they want to exercise their financial muscle. So if you create employment and give it to a man who feels that I need to ascertain my manhood through abuse of alcohol or consumption of alcohol, then we're not doing any good. That's why we need an integrated approach that takes into account the role of the community, the role of the individual, and the government's responsibility as well, and come up with an integrated approach. And then just quickly, and sorry about that, I wanted to highlight this issue, the media. The media plays a very central role. We need to embark on gender-based violence campaigns throughout different media platforms. And also in higher education, in society, we can do webinars like we're doing now. We can also have outdoor campaigns, because these have a power to reach out to a wider population and hear the concerns and hear the stories from the communities, so that at least whatever approach we adopt, it is informed by grassroots experiences and grassroots suggestions instead of a top-down approach. So this is quite important for us to explore the power of the media. And also we need future research, like I've just said, that takes into account the different levels. And this is a countrywide study that can be commissioned and that can bring together different departments, for example, Department of Justice, Department of Women, and other stakeholders like UN Women, among others, to ensure that we have the story captured properly in terms of what are the key issues, how they, especially when it comes to social norms that are difficult to define. We can suggest, but if it doesn't come from the population, we are missing the point. Thank you very much, Anne.
Okay, thank you so much, Dr. Kezia. Thank you so much for giving us that expose and inputs. We will have questions, so if we could please have, I see there's some questions already for Dr. Richard, if you could put some questions in the chat. I thought that you'd be able to raise your hands, but I think because of security reasons, we don't all have access to the mic, so if you could drop your questions in the chat, please, I will be able to pick those up after this session. So thank you. Now I have Dr. Mwangi, Dr. Joseph Mwangi from the World Health Organization. After him, then we'll have a chance to have a conversation and ask questions. I see there's also quite a bit of interest in the actual presentations. So we'll ask the department as they're organizing and to see if Dr. Richard and Dr. Kezia, if your presentations are shareable, you can PDF them or whatever you need to do to secure your information. But let us know if it's okay to share the presentations. Okay, Dr. Mwangi, karibu sana.
Thank you, Anne Shongwe and colleagues, the program director, you're doing a splendid job, the Honorable Minister and the Director General in charge of the women, youth, and persons with disability, fellow panelists and ladies and gentlemen, thank you so much for having us. Apologies at this onset from Dr. Kalua, the WHO country representative here in South Africa. As you may be aware, WHO is working with the National Department of Health to deploy experts across the provinces to help halt and reverse the burden of COVID-19. So he had to attend to some issues on that regard. So apologies for that, but I'm here, I'm in charge of non-communicable diseases and I'm glad to participate in this. And I start by reiterating what Richard mentioned, and thank you so much, Richard. I'm happy to present after Richard and Professor Kezia. It's interesting that we didn't have much of the info in terms of exactly what the limits are, and so Professor went ahead and did a splendid job. And Richard, thank you so much. We depend a lot on Richard's work, also here in South Africa, for the great work that they are doing insofar as alcohol consumption is concerned. So thank you, Richard. And your statements about our attention to conflict of interest, WHO takes it very seriously, and so our participation should not be misconstrued as an endorsement of responsible drinking while thinking about policies together with the alcohol industry. So let me just begin by thanking you for having us on this National Women's Month. The WHO is glad to partner as we celebrate and reflect on the heritage and the meaning of the phenomenon journey that the South African woman has had. Violence against women, unfortunately, is one of the most prevalent human rights violations in the world, and it knows no socio, economic, and national boundaries. It's actually very heartbreaking to note that worldwide, according to United Nations report, it estimates that 1 in 3 women will experience physical or sexual abuse in their lifetime. And as the Honorable Minister quoted earlier, the WHO global, regional, and country levels cause-specific mortality estimates show that South Africa's age-standardized interpersonal violence death rate for the female population stands at 12.5 per 100,000 population. Now, this is about 4.8 times higher than the global average of 2.6, making South Africa among the top 100 countries in interpersonal violence death rates for the female population. Gender-based violence and femicide undermines the health, dignity, security, and autonomy of its victim, yet it remains shrouded in a culture of silence. Victims of gender-based violence can suffer a lot of physical, psychological, sexual, and reproductive health consequences that include forced and unwanted pregnancies, unsafe abortions, traumatic fistula, sexually transmitted infections like HIV, and even death. Honorable Minister, while we appreciate that the determinants of gender-based violence are multifactorial, studies of intimate partner violence globally have routinely identified recent consumption of alcohol by the perpetrators. Alcohol consumption, especially at harmful and hazardous level, is a major contributor to the occurrence of gender-based violence, and there exist strong links between alcohol use and the occurrence of intimate partner violence, and especially violence against women in many countries. In fact, one of the systematic reviews pooled the results of 11 studies and found that harmful use of alcohol was associated with a 4.6 times increase in the risk of exposure to intimate partner violence compared to mild or no alcohol use at all. Well, beyond the violence, men who use high level of alcohol are more likely to engage in risky behavior, sexual behavior. For instance, multiple sexual partners, inconsistent condom use, coercive sex or rape, and transactional sex, which increases their overall health risks. As you may know, alcohol use directly affects cognitive and physical function, and I'm happy that Richard went on and described the linear relationship between the level of alcohol inebriation and the resultant behavior and outcomes. And it reduces self-control and leaves the individuals less capable of negotiating a non-violent resolution to conflicts within relationships. For the perpetrators, the higher and the heavier consumption, the more frequent alcohol increases the risk of violence. So you may know that experiencing violence within a relationship can also lead to the victim engaging in alcohol consumption as a method of coping or self-medicating, resulting to many other ill health consequences related to alcohol. It's also sad to note that children that grow up in homes where they witness violence and threats of violence between parents, and especially where alcohol is involved, are more likely to display harmful drinking patterns themselves later in life, and an increased risk of becoming perpetrators of violence and being violent later in life. So alcohol induces violence, has serious short and long-term consequences on women's physical, sexual, and reproductive, as well as mental health, and has a negative effect on their personal and social well-being. While Richard and Kezia have focused a lot on the physical and the direct links and a lot of research on it. We focus mostly on a little policy imperatives that we may need to look at, considering that this is a round table that brings us together to try and see where do we solve this problem. Gender-based violence and femicide is a big problem in South Africa. So we are glad to sit around the table to come up with a supportive policy that would be able to stem these. We may need to protect, and it cannot be underscored, the importance of protecting and empowering women and children. This is a formidable intervention that calls for multi-sectoral action. It's not an only Ministry of Women and gender issues. No, this is a Ministry of Education, Ministry of Health, many other ministries that would work together to create a climate of non-tolerance to gender-based violence. Of course, we need to adopt a life cause approach that focuses on prevention of harmful use of alcohol and gender-based violence mitigation interventions across the stages of life. As you may know, all stages of life present opportunities for interventions. It is not only to be focused at the adult population, even in schools, even in children, teenagers as they grow up. And Professor Kazia has really talked about the transformation of cultures and social norms related to gender. For example, combating the societal tolerance towards gender-based violence, and also the acceptance of excessive drinking as a mitigating factor for gender-based violence. Also, she has talked about addressing the normative beliefs about masculinity and heavy drinking, which I think is a good direction to take policy-wise. We may need to promote and implementing the laws that exist. They are there, and the policies, and to support and tighten them related to both harmful use of alcohol and containing violence against women. And of course, this calls the harnessing of partnerships with state, non-state actors, civil society, community groups, religious organizations. I'm happy that she mentioned the media, very strong driver for societal change. Of course, we are supporting the integration of gender-based violence, recovery and treatment into the universal health coverage platform for both the perpetrators and also the victim, because treatment and support of alcohol use disorders and dependence is important. And in this regard, WHO supports increased capacity building of healthcare workers, as these often are the first line where victims run to. And so they offer both physical and psychological support. We promote and we ask for multi-agency partnerships to tackle gender-based violence by raising awareness and supporting advocacy for policy and legal change to protect victims of gender-based violence, to tackle excessive alcohol consumption, and to create an environment, very important, of zero tolerance to gender-based violence. Of course, we are here to support regional research, and we are happy about the work that Richard and Kezia and all the other organizations represented here are engaging with. So in a nutshell, let me just say that we as WHO, we reiterate that gender-based violence is linked to poor health outcomes on the victims, their families, and the community at large. Harmful use of alcohol is a major contributor of gender-based violence, crimes, and femicide. And health services, when accessed in time, can provide critical and time-sensitive interventions for sexual assault, such as emergency contraception for the victims to prevent pregnancy, and post-exposure prophylaxis for HIV, as well as presumptive treatment for sexually transmitted illnesses. We as WHO support governments across the world to ensure that health services also provide the first line of psychological support for the survivors, link them to the appropriate referral for specialized gender-based violence services. And finally, we support and promote and participate in multi-agency partnerships like these ones to tackle gender-based violence by raising awareness and supporting advocacy for policy and legal interventions to protect the victims of gender-based violence, tackle excessive alcohol consumption, and increase an environment and create an environment of zero tolerance to gender-based violence. Let me finish with the words of the former United Nations Secretary General, Ban Ki-moon, who retorted that there is one universal truth applicable to all countries, all cultures and communities, that violence against women is never acceptable, it's never excusable, it can never be tolerated. Thank you for having us.
Thank you so much, Dr. Mwangi, for that very useful input, and thank you for the partnership. We do note your point about WHO's presence here not being an endorsement of industry, and we hear that loud and clear, and we want to just recognize and appreciate that you've been able to make the time to be here. And we're also grateful for all the different policy interventions that you've proposed. I think we will have a chance, and there's been quite a few questions in the group. I want to check something. David Harrison, because Dr. Richard has been making reference to your work, I'm just wondering, even though I don't want to stretch this panel any longer, but I'm just wondering whether it would be useful to have your input here so that we capture all the different research and sort of policy pieces then, and then we'll go into the sort of practical approaches in the next panel. Do we want to?
Thanks very much, Anne. I'd certainly be happy to come in. Let me try and share my screen with you.
All right, thank you.
Is that sharing? Not yet?
Not yet. We see beautiful trees behind you.
Oh, that's great. I'm just going to move.
But all right, while you're doing that, let me just say from the panel, just for the sake of the of the people in the group, Dr. David Harrison is the CEO of the DJ Murray Trust, a South African foundation with a strong focus on early childhood development, education, and youth leadership for public innovation. He founded the Health Systems Trust that we have known about for many, many years, a pioneering organization supporting health policy and services in South Africa. If many of you will recall, there used to be, or there was, I think it may still be there, the South African Health Review, which was an annual review of health and healthcare. He also headed up Love Life, the National HIV Prevention Program. He joined the DJ Murray Trust in 2010, where he has spearheaded a number of national initiatives aimed at reducing nutrition stunting, expanding access to early learning, promoting early language development. And I know that he's been doing a lot of work that is leading some of these social issues, especially alcohol related. David studied at UCT and public policy at University of Berkeley. So it's wonderful to have you here. But let's see, that looks like a nice balancing act that you're about to share with us. So go ahead.
Thank you very much. And thank you to everybody who's on this call. And also really just appreciative of the Minister and all of those that responded to that letter that was signed by about 150 researchers and academics, calling for the implementation of 5 key strategies to reduce alcohol harm in South Africa. And so that's really what I'm going to focus on in my 10 minutes. And I'm not going to go into much detail here, but you know, in 2009, 2010, that data was used by both by health researchers and by Treasury to look at the cost and benefit of alcohol. And in summary, this is what it shows. If you just have a look at the direct contribution of the alcohol industry to taxes versus the direct cost to the fiscus, you could argue, and it's a little bit equivocal, that the net benefit is on the side of the alcohol industry. When you look at the spin-off effects, including employment, tourism, the wine industry, etc., versus the individual loss of earnings and related welfare costs, it's still pretty equivocal, maybe still tipping towards the alcohol industry. But it's really important that we start to factor in all the costs and all the benefits, recognizing the value of the alcohol industry to the economy, but also finding far better ways in which we can begin to reduce the cost of harm of the alcohol industry in South Africa. And the moment you add productivity losses, the moment you start to assign any sort of value to life, economic value to life or to health, we see that the net effect is very, very strongly on the negative side. We're not calling for a ban on alcohol, but it's absolutely imperative now that we address this reality. That's the economic side. We also are talking now about the social side. And I think this is where much of the public conversation has happened. On the one hand, protagonists of alcohol really emphasizing the personal enjoyment, the individual rights, etc. On the other, people really pointing to some of the social harms, fetal alcohol syndrome and the rest. And what I think is pivotal here, what is really, really important to understand is that our understanding is that government is saying that gender-based violence is, and its eradication is a national priority. And in a way that helps to give, that helps to calibrate this balance. It's actually saying that no longer will we tolerate personal enjoyment, socialization, and camaraderie at the expense of women and children who are suffering gender-based violence. That's the key message that we're hearing. So the question is how does one do that while at the same time recognizing and protecting the economic benefits that the alcohol industry brings? And I think Professor Kazia made a really important point where she said, the starting point is that there is a culture of heavy drinking in South Africa. And the point that I want to make here is that if you have a look at the percentage of young people in particular, and young men in particular, who drink extremely heavily, and by that we're defining heavy drinking as more than 5 drinks, 5 units of alcohol at any one setting. You can see that our young men are drinking extremely heavily, and this is setting in place lifelong patterns of heavy drinking that need to be combated. Note that not everybody in South Africa drinks, and it's only about 40–45% of men and 20% of women who drink. But those who do drink more than twice the national, the international, the global average. And that's what needs to be addressed. And so we're really trying to get to grips with how do we change this culture of heavy drinking. And the one point that hasn't been raised that is really, really important is that we need to understand the relationship between heavy drinking and its apartheid origins in South Africa. And all of us are familiar with the DOP system that resulted out of the abolition of slavery and the desire for cheap client labor. We know that. But the one piece that probably is not emphasized enough is the disempowerment of Black women who were producers of the sorghum beer industry in the 1928s, the creation of these municipal beer halls for working men. And then in 1961, where Black Africans were allowed European liquor, how the profits from those municipal beer halls were then used firstly to fund urban upgrading in townships, but increasingly been used to fund the evolution of the Bantustans. And it's absolutely crucial that we understand that these structural underpinnings of the culture of heavy drinking, setting up places for people to drink, for men particularly to drink heavily, tying those profits into the evolution of the Bantustans with the support and the compliance of the alcohol industry really has laid the basis for these patterns of heavy drinking that we see. And it continues to play out. So if we have a look at the percentage of men who drink heavily, we see that it's concentrated among colored and Black African men compared to whites and Indians. Those men who drink heavily, who are employed for cash, in other words, piece jobs, as opposed to those who have formal employment, in other words, not employed for cash, also drink much heavier. And so I think if we're going to get to grips with this, we've got to understand this vicious cycle that's got to be broken. Socioeconomic marginalization drives heavy drinking. Heavy drinking drives socioeconomic marginalization and results in a situation where alcohol and smoking together account for 1/3 of measured inequalities of health in South Africa. So if we are serious about addressing 3 major national priorities, reduction in mortality, reduction in gender-based violence, progressive social development, there is no way through except for curbing heavy drinking. And so as we sort of move to what needs to be done, And it's useful to come back to what President Ramaphosa said on the 17th of June, because we mustn't get stuck in this divide. Is it alcohol that's, or is it gender-based violence? Let's be clear. Gender-based violence is about power differentials. It's about how men think and act towards women, but it is hugely aggravated by alcohol. And so as we seek to address this in a comprehensive way, we have to address both the long-term strategies, ensure that we're changing the norms of young people as they grow up, as well as addressing some of the most immediate aggravators of violence against women and children. And there are no quick fixes. There's no silver bullet, but there are 5, and I'm glad I'm speaking after the representative of the World Health Organization, at least 5 best buys that WHO has shown that are not drastic. They're actually highly cost effective. They're feasible. They're implementable at low cost. And they are a comprehensive ban on alcohol advertising, an increase in the price of alcohol, reduction of the legal drinking age, reducing the availability of alcohol, and increasing access to counseling. I only have a few minutes, so I'm not going to spend much time on it. We can certainly pick it up again in the discussions. But what is clear from international evidence and from our own South African experience with respect to smoking is that we need a ban on advertising alcohol, except at the point of sale, where it's not visible to those under 18 years of age. Any sort of piecemeal or partial introduction of a ban, of an advertising ban, is not going to work. In South Africa, we saw how vital this was in reducing the prevalence of smoking, even as rates of tobacco and smoking increased in the rest of Africa. I've got to speak about young people. Studies really showing that the more exposure to alcohol advertising, the more young people are likely to drink. Every medium that they're exposed to increases their risk of early uptake of alcohol consumption by 13%, which means that if they're exposed to 6 or 7 media platforms, they've got double the rate, double the likelihood of drinking than if they were not exposed. We need to raise the price of alcohol, and I don't have time to go into this now, but we do know that young people and heavy drinkers are more sensitive to increases in the price of alcohol. And there are 2 ways that needs to be done. One, if we have a look at excise taxes in South Africa, excise taxes on alcohol, unlike tobacco, are far lower than they were in the 60s and 70s. That needs to be corrected. And then secondly, we need to introduce a minimum unit price. We know in South Africa that heavy drinkers are accessing alcohol for about 1/5 of the price of social drinkers because of differentiated pricing strategies by the industry. We cannot have a situation where poor people have access to cheaper liquor in ways that encourage them to drink more. And so we need to learn from international experience. Scotland, for example, has introduced a minimum unit price that has showed a 4 to 5% reduction in consumption, especially among heavy drinkers. If you have a look at South Africa, you see that the big liters of beer, or 750 mils of beer, are provided at a lower unit cost of alcohol than the smaller containers are. These are things that we've got to now to combat. I'm not going to talk about the legal limit for drinking and driving. That's crucial. It's got to come down to at least 0.02, and we can speak about the reason for that threshold. People have spoken about the shorter trading hours. We also need to speak about the density of liquor outlets. The higher the density of liquor outlets, the higher the interpersonal violence. And we have to end the sale of alcohol in large containers, like 1 liter bottles, and 5 liter of beer and 5 liter wine bottles. We know that people who drink from bigger containers are 8 times more likely to drink heavily than those that are not. And then, of course, there needs to be greater access to counseling and treatment. We know that brief interventions aimed at younger people, aimed at women, when they're pregnant, can actually prevent fetal alcohol syndrome, can actually prevent young people from drinking so heavily. So my last slide is that we've got to make good come from COVID. And in a way, COVID has been a natural experiment. We've spoken about it. Let's understand that South Africa's heavy drinking culture is steeped in the structural violence of apartheid, and it requires structural intervention. What won't work? We know that total bans on alcohol can't be sustained. That'll just create the mushrooming of illegal industry. We can't simply focus on the individual and individual choice. The approach of the industry about responsible drinking is acontextual, it's ahistorical. It doesn't recognize that marginalization drives heavy drinking drives marginalization. And as Richard has said, the industry itself, its business model relies on heavy drinking. So of course we need the industry to play its part, but we also need government to put in place this package of interventions that together can create a virtuous cycle. It's going to take time, but if we put those 5 best buys in strategy, and we can't pick and choose because they all need to reinforce each other to get the cycle of positive development happening, if we're going to reduce mortality, GBV, and social fragmentation. If we do those 5 elements, and if it's in the context of the broader a gamut of responses to GBV, we will begin to change the culture of drinking, and we will start to see reductions in femicide, rapes, and other forms of gender-based violence. There's a fantastic opportunity now. There's the political will, I think. There's the public desire for us to do something about, and we're really, really grateful that the Office of the Presidency and other line ministries as well are approaching to say, now is the time to act, and we'll certainly be supportive. Thank you very much.
Wonderful, wonderful. Thank you so much. Thank you so much. Let me now, thank you so much, David Harrison. This is very useful. Okay, so I think we have all the facts on the table. We have, of course, we will hear from industry in the next session, and we will hear practical experiences from a survivor of violence, and we'll also hear from the taverns and the SACBC Catholic Bishops Conference in the second part, but that's really about some of the implementation issues. So I'm going to go to some of the questions which are in the group, and I think some of you have already answered them. So I think there's quite a bit of interest in the presentations, and so we're working through that. I think we're asking to have the presentation sent. A question from Karen from Mosaic. I especially appreciate the focus on the drinking. This is to Dr. Richard. I especially appreciate the focus on the drinking behavior rather than a generalized view that it is alcohol on its own that drives the high rates of violence. It is imperative that we do not remove the individual behavior and use violence out of the narrative interventions, need to work towards behavioral and attitudinal change. I think it's a comment rather than a question, but I'll see whether you as the panelists, I'll give you a chance to do, you know, an overall comment just to wrap up the session. Another question was, please provide clarity on the alcohol industry's role. They should play in promoting responsible drinking. Are you saying that they don't have a role? This is from Patricia Pillay. And I think Richard has answered and says, no, I'm not saying that they don't have a role to play. I am saying that they have a conflict of interest to ensure that the current pattern of drinking, you know, irresponsibly and drinking extended hours, the current pattern of drinking is maintained. So it's in the interest of industry to maintain the current pattern, not to actually promote responsible drinking. So there's a conflict of interest, I think is what he's saying. So they'll advertise, you know, responsible drinking, but actually it's in the interest to continue the current pattern. What is the cause of gender-based violence? This is from H. Ndlovu. To all the experts and government leaders, what is the cause of gender-based violence at its core? All right, so that's another question that we can perhaps answer. For context, gender-based violence has been a major problem in our country for decades, even before we found our freedom. Have we done a study to understand why we as a nation have such high GBV behavior? So panelists, that's a question coming back to you. Is there any other question? Here's another question to Richard. Given the extensive variations of determinants, including access, this is from Eugene, access, affordability, health status, is the concept of responsible drinking reflecting a general understanding of its evident contribution to interpersonal violence, road accidents, and gender-based violence? And I would open that question actually to all the panelists, because I think, you know, it's all of you commented differently about this issue. And so I will extend that question from Eugene, the extensive variations of determinants, including access, affordability, and health status, around the concept of responsible drinking, reflecting a general understanding of its contribution to interpersonal road accidents and gender-based violence. Let me see if there's any other question.
There's a hand from Iris.
Oh, good. All right. I was told that we may not be able to unmute the mic. So Iris, I don't know if we can unmute her. Can we unmute Iris? If not, then Iris would need your question in the group.
And I also want to ask a question.
Okay, there's also a question. Oh, she can. Okay. Oh, sorry about that. I was told we couldn't ask questions. So go ahead, Iris.
Okay. Thank you for the opportunity to make my very brief contributions. I just wanted to reflect on Prof. Kizea and David's presentations and just speak to 3 quick points. Firstly, I really appreciated the way David and Prof. Kizea highlighted the importance of the interplay between the structural, community, and individual factors, because the very systemic nature of gender-based violence and femicide and harmful alcohol use demands of us to define these critical levers that can shift structural, community, and individual level manifestations. And I believe that this is what makes those 5 urgent measures to curb alcohol harm linked to gender-based violence so powerful, because they provide us with pragmatic measures that can shift drivers at both systems and individual levels. I also think it's important to view those 5 urgent measures in conversation with the 5 key interventions that were outlined in the Emergency Response Action Plan to address gender-based violence and femicide, as well as in the National Strategic Plan. The work of organizations such as Sonke Gender Justice highlights that interplay of dominant masculinities, GBV, and substance abuse. We've seen that in terms of what works, interventions that aim to transform masculinities to become more equitable in order to reduce intimate partner violence, such as Stepping Stones and Creating Futures programs in South Africa, have reported significantly lowered perpetration of intimate partner violence and non-partner sexual violence. Furthermore, these interventions have also been found to reduce harmful alcohol consumption. Thirdly,
Iris, do you have a, or you just make your comment? You don't
yes,
have a
it's
question.
just comments, no questions.
Okay, all right. Just a quick one then.
Sure.
Go ahead.
I also wanted to highlight the intersections around mental health and what we've seen in civil societies are programs designed to operate at the intersection of harmful alcohol use, gender-based violence, and mental health are shown to contribute to reduce gender-based violence and harmful alcohol consumption, especially when targeting couples, families, and men. We've seen this from the Couples Health Co-op intervention in South Africa and the Violence and Alcohol Treatment Program in Zambia, which reduced poor mental health, the IPV perpetration, and harmful substance use through brief 6 to 12 weeks interventions. Thank you.
And all right, thank you. Thank you, Iris. Go ahead, Mabatu.
I think for me, David has just addressed one of the elephant in the room, how apartheid socialized Africans, especially in terms of issues of alcohol abuse. But now they have raised the suggestions, I mean, the recommendations from WHO that have been suggested. Now I'm looking at alcohol abuse and also about food. You know, when there was a discussion around obesity, the reduction of the plates that have big plates to be reduced to small plates. Don't sell fizzy drinks in big bottles. Is there any recommendation that can be included in reducing the alcohol content itself, not from whether 7% to reduce the alcohol itself to low, so that people don't get drunk to the way they get drunk? Because if people are still going to continue drinking, and if you drink something of 7% or 14%, even 3 glasses itself or 3 bottles will definitely make you get too drunk. So is there something that WHO in your interventions are looking at? The reduction not only of the big bottle, but of the alcohol content that should be in a specific bottle. Yeah.
Hi, I have 2 questions. I see Sinesipo. Same, I'm thinking, would you like to ask your question aloud? And then I think that's it. And I will then go back to the panelists to respond to the different questions. So Same Mfundisi, I don't know if you want to ask the question, or do you want me to just go ahead and read it? And I think it's Sinesipo.
Read it. Read it.
Okay. Let me, Sinesipo, you can ask your question.
Oh, is she unmuted?
Oh, Tame is saying she's muted. Can you unmute Tame and Sinesipo, please?
Chair, Program Director. Program Director.
Yes, Minister. Yes, Minister.
Yes, because this is a conversation and I'm liking the way we are, the experts are assisting us in making this roundtable sharing of information go. I am still thinking of a question that I don't know if anybody is going to answer from you. That of, is alcohol an enhancer? Or is alcohol responsible? Or is it patriarchy? But I think one of your panelists, in particular, Dr. David Harris, had attempted to answer some of what I'm trying to answer. I'm very keen to hear, because we've been talking about drinking, but we haven't had SAB, BEV saying something, contributing to how do we continue to protect livelihoods and also making sure that our people remain healthy and that our children and our women are protected from gender-based violence. I do have many other questions, but at one stage I was thinking we're beginning to talk to ourselves because there's a lot of agreement in between us, but we are not getting the other side of the story. Thank you.
Okay, all right, Minister. I think that I'll just get the panelists to respond to a couple of these questions, and then we will move to another group of speakers, and within that we will have the SAB AB InBev. We will also have the Tavern program, and we will have a survivor who will talk about her particular experience. And we can then continue with the conversation. So we will get back to that question. But let me take Tame's question, and then I'll go back to the panelists. Tame is saying, I think we also possibly need more advertising about responsible drinking. I think that also truckers' debates even within our families. I'm not sure what truckers' debates means, but I'm assuming you're meaning that there should be more of this sort of debates within our families. I know Black Label is also keen and encouraging young men and older men to have this conversation. holding each other accountable. I believe the liquor companies should work together to amplify such an alcohol consumption and take responsibility when and after consuming alcohol. I saw a comment from Heidi Bartis, who is here from AB InBev. Heidi, I think you'll have a chance to share your overall perspective. So let me not put this on the table necessarily, but you are saying that you have some discussions on low alcohol. I know during lockdown, there was non-alcoholic beer that was available for those who wanted the taste but couldn't get the actual alcohol. But we will learn from that in the next session. So let's see if we can wrap up this one. So Sinesipo, I didn't see your hand. Is that the one that has come up? Oh, there's something from Emmanuel. Acts such as public drinking, alcohol sales to minors and taverns operating beyond the regulated hours are now common, and they're slowly becoming socially acceptable. Emmanuel, we have seen that acts such as public drinking, alcohol sales to minors, and taverns operating beyond the regulated hours are now common, and they're slowly becoming socially acceptable. And that is because of our poor law enforcement. In your discussion, Minister, with other ministers, please encourage an intensified law enforcement strategy. This also includes alcohol sale to pregnant women. Since, Minister, you're responsible for women and youth in the presidency, please let's protect children who can't protect themselves. We know about fetal alcohol syndrome and other fetal alcohol spectrum disorders, which affect newborn babies should their mothers drink during any stage of pregnancy. However, there is no law that I know of which protects the babies. We cannot open cases against those women should we witness them drinking. Not even DSD can assist on that. Please, let's take this to Parliament and protect and have a law on this. All right, so lots of comments and lots of questions. Panelists, I'm going to go back to you so we can wrap up this session. So Dr. Richard, you've had a couple of questions referred to you. I'm just going to give you a chance to respond to whichever one you think is important and use this to wrap up this part for you. And then I'll go to Kezia, Dr. Mwangi, and Dr. David as well, just to get your inputs to the questions that have been raised.
Thank you.
Oh, here's Sinesipo's, sorry, Richard, one last question. This was Sinesipo's question. My question to experts is there any research that shows alcohol to affect men differently from women? Is there research that shows alcohol to affect men differently from women? Okay, over to you.
Thank you. Okay, I was going to make two comments, but let me just start by addressing that last question first. Yes, I mean, there are different relationships for all diseases actually between men and women. Some of them are the same, some are different, but certainly they do affect men and women differently. I wanted to speak about that as the first issue really, is the impact of alcohol. And I didn't get enough time to go into it in much detail, and I won't here, but I wanted to emphasize that alcohol affects us based on how much we drink. And the more you drink, the more it's going to affect you across a range of diseases. And so for injuries and interpersonal violence, the more you drink, the more at risk you become of becoming a victim and for engaging in aggressive behavior. What really escalates it for interpersonal violence is the pattern of drinking. So as soon as you have a binge drinking event, it has a dramatic increase, and the frequency of binge drinking events increases at every instance of a binge drink increases the risk that many times. So those are the factors that actually link alcohol to interpersonal violence. Whichever way you look at it, it's really around the quantity and the consumption pattern. There were a couple of comments and questions about complexity, both in terms of addressing individual interventions and also risk factors for violence, which I want to touch on briefly as well. Firstly, I think David presented it very well, a basket of interventions. And if we're going to be doing this for alcohol, we need to adopt multiple interventions happening simultaneously. We can't pick one and then try and pick holes in that individual intervention. We need a basket of interventions and they reinforce one another. I think that's very important. And I think that's important for violence prevention generally as well. So my last comment is around the complexity of risk factors and what drives the high rates of GBV in South Africa. One of the comments I think two of the comments, in fact, spoke about the interrelationship between different dimensions of risk factors. And that is very true. And we're focusing on alcohol here as a major upstream driver. But of course, there are many other things happening in our communities and society that drive high rates of violence. In terms of gender-based violence specifically, I think the thing that we often ignore is that we live in an incredibly violent society. It's not unlikely, or it shouldn't be a surprise that we have high rates of gender-based violence or high rates of child abuse. We have a very violent society, and that's one of the major drivers. So much as we look at multiple interventions for alcohol, we should be doing the same for violence. And the WHO also has a range of evidence-based strategies for violence. What we're talking about now is really about strengthening communities, the alcohol interventions, but we should also be looking at investing in early interventions in a child's life, increasing positive adult involvement, changing cultural norms, reducing income inequality, improving criminal justice and social welfare systems. So as we have for alcohol, there are a range of evidence-based interventions for violence. In both instances, we should be trying to adopt multiple interventions, particularly if they're evidence-based simultaneously. Just another word of caution though, we shouldn't be distracted by interventions that are not evidence-based. And there is a commitment for us to actually do the research properly to actually back up rolling out interventions. There's a question about responsible drinking as well, but I think we're probably going to get to that in the next session. My question around that is, what is it? We talk about moderate drinking, we talk about levels of consumption, we don't have a scientific definition for responsible drinking. So I'll leave that question open, thanks.
Thank you so much for that. Yes, we will indeed discuss that in the next session. So Heidi, I think that's already a question for you to think about. I'm sure that's going to be one of your key areas. Just how do we measure it? How do we know what responsible drinking is? Dr. Kezia, Prof. Kezia?
Thanks, Anne. I would like to start with the minister's question about alcohol, whether alcohol is an enhancer, it's responsible, or there are other factors like patriarchy. And from where I stand and from the research that I did, I would say that alcohol vis-a-vis other factors, it is responsible for gender-based violence. So if you look at alcohol vis-a-vis other contributing factors, it stands out as a factor that contributes significantly to gender-based violence. But if you look at alcohol at a micro level, you then begin to unpack alcohol consumption behavior patterns, and then you reduce it to the individual. What is the role of the individual? What level of consumption and what are the patterns at individual level? So I would say it's a mixed cocktail when it comes to the answer whether alcohol is an enhancer or what. In this case, we are saying there are multiple factors that contribute to gender-based violence, but on top of the list, if you look at the factors as a whole, alcohol is quite significant, but in relation to others, we can now begin to look at the individual and the responsibility of the individual, and questions of behavior change come into question as well, where we say, what is the role of the individual? What is the individual doing to eliminate the problem with alcohol consumption? And this links to the question around what have we done to understand why we as a nation have such a high gender-based violence behavior. And I would say that there's the question of research. I'm coming from a research background, and I would say that there've been fragmented efforts. Take, for example, sexual offenses. There is a lot of research that has been done, but it's fragmented. And by fragmented efforts, I mean that research has been done, but people selectively focus on provinces as site of data collection across the country. And I would say for this particular project, I'm funded by so and so, and I'll look at Eastern Cape and the Western Cape for these particular reasons. And that creates a silo. At a national level, we don't get to see a holistic picture of the problem. And I'm saying, let's engage in countrywide researches that allow us to have a better picture, a better impression of the problem at hand. And this takes me to Mabato's question about the apartheid system and the socialization, and also what David said about the role of apartheid and its history. So if you look at ERA, the Emergency Response Action Plan, the call to unlearn certain behaviors, unlearn dominant masculinities. How do we do that? It's through dialogues, it's through engaging with communities and individuals at different levels. It could be at society level, it could be at university, school level, to ensure that those dominant masculinities that perpetuate gender-based violence in our societies are, eliminated. So we need to unlearn some of the things, some of the gendered positions and standpoints that we assumed as through our socialization and our engagement and interaction in society. And then on the issue of, and it's good that there's mentioned that there's political will, there's public desire. There was mentioned by David that there's that there's political will, there's public desire, and from the presidents and government at large, this is the time to engage in that kind of conversation. But what I'm seeing here, what's missing is the community. Let's talk to communities. Because someone said, how do we define gender-based violence? What does it mean at its core? And this is something that will never come from the top. It will never come from researchers ourselves. It will never come from government representatives and other stakeholders, but rather it will come from the grassroots. Because from the grassroots, that's where we get to understand those minute social aspects that are central to gender-based violence. It's perpetuated by those small little things that we sort of trivialize if we're coming from the top. So let's talk to the grassroots and hear how they define gender-based violence. What is gender-based violence? How is it linked to alcohol abuse? And what are your perceptions when it comes to the patterns of drinking within your household, within your community? What needs to be done? Let's have that informed point of view. Thank you very much.
Thank you, Prof. Kezia. There was a comment here that industry is also committed, but we'll come to that one in the next session. So, Dr. Mwangi, over to you. Quite a few references to W and your policy guidance. So let's hear your inputs.
Sure. Thank you, Anne, and thank you for my fellow colleagues in the panel who have really, galvanized the issue around that causes of gender-based violence are multifactorial. There's no one single issue that causes it. And you would say, somebody asked the question, what causes gender-based violence? It's difficult to say it is 1, 2, or 3. There are many factors, and that calls for a whole of society and whole of government approach to it. It's not just an internal security or Ministry of Gender or Health or Education. It's an entire government approach to it. And I'm happy that you have put together the sociological perspective, and Professor Kezia is bringing it in, because sometimes we focus so much on the medical or the gender perspective and forget that it's about behavior change and all these things, and they are qualitative sometimes in nature and require experts who can look at our behaviors and how we can change behaviors, and it takes time. Let me just look at the issue around, the minister asked very interesting questions, and I'm sure some of the answers or controversy will come in the next panel about the level of alcohol, about issues that would be done at a population level. There are interventions, and I'm happy that participants talked about the WHO best buys. And the best buys are just a simplified 5-pronged approach, which a country picks. And the best thing is not to cherry pick and say, oh, we'll just take number 1, because there are a comprehensive approach that if we do all of them, we are able to do much more towards preventing the damage of alcohol. At the wake of the SDGs, the WHO together with UNDP and many other UN organizations came up with a campaign that exemplifies the 5 best buys plus the SDGs, and it's called the Safer campaign. I might just, if you allow me, I'll just shoot the brochure so that you can see what it contains. It contains 5 elements, and these are strengthening restriction on alcohol availability. There's advance and enforce drinking driving countermeasures, facilitate access to screening, brief interventions and treatment. This is for healthcare workers, and enforce bans on comprehensive restriction on alcohol advertising, very important. And finally, to raise prices of alcohol through excise tax and pricing policies. Right at the base, you will see that this has benefits across the entire spectrum of socio-developmental. When you look at it as socio-developmental issue, it's not just a one sector issue. So you may later look at this brochure and maybe look at the safer. It contains the 5 best buys, but also goes ahead and looks at it in a social developmental perspective. And I must say, a country has to take some of these policy recommendations and move from the best buys to the must buys. Because South Africa has to come up and say, okay, amongst these, we must use these, all of them, but the must buy is this one that we'll start with. Leadership is key. And I'm happy that it's coming from the very high top office. The minister is very committed to address gender-based violence. Leadership is very key, and it's good to lead from the front. Madam Minister, I'm happy that you're doing this. If you look at the most important thing that a lot of criticism comes is when we don't have data that can be relied upon. So surveillance is very important. You will notice that a lot of alcohol consumption is off the radar, and that alcohol causes a lot of harm. Because it's off the radar, and we need to improve our surveillance. The last point that I would make, during the presentation by Richard, and I don't know whether it was Richard or another slide, there was a slide showing the levels of binge drinking vis-a-vis the ages. And you will see that as you go up the ages, men have a bigger problem, of course, than women. But as you come down towards the teens, the 15s and the 18s who are in campus, in high school, these people are at par. And the question that begs, and you will see the same if you look at tobacco data, the question that begs is 10 years from now, we'll have obliterated that difference, and it will be a bigger challenge. So we need to put interventions today, especially advertising alcohol in such a way of emancipation or freedom, or that affects both genders and push things, especially in the social media platforms. So I'm happy if we are able to again move this debate to now more physical and more targeted approach, and I'm glad to stay on and listen to some interventions later. Thank you so much.
Wonderful, wonderful. Thank you so much. I think we would all love to take a look.
And you've got
Sorry, I was muted. Sorry. I was just saying that Dr. Mongi, if you could please share that brochure, so that the safer one or the website link, you can even put it in the chat. We can then share it with everybody so people have a chance to look at it. Okay, go ahead, David.
Thanks very much. I won't be long. Just 2 quick responses. One was, are there interventions focused on reducing the alcohol content? And I do think it's useful just to cite the example in Britain. Stella Artois used to be known as the wife beater, a very popular drink. And the alcohol content in that was ultimately reduced, and it was associated with a reduction in intimate partner violence. So that is an important point that needs to be made, that we also need to have a look at the alcohol content across, for example, beers, and make sure particularly that anything that is particularly favored by young people does not have high alcohol content, even as we put the other interventions in place. I think the point about we're trying to unravel very complex relationships, and I think it's the minister's question is really, really important, trying to understand what is the link between patriarchy, gender-based violence, and alcohol. And there are some, and we've focused a lot on the public health associations. We know that 40% of rape perpetrators say that they were under the influence when they committed that rape. We know that 61% of women who are victims of femicide have high blood alcohol content in their blood. So we know those associations, but how do you start to relate one to the other? Now, if we have a look at the relationship between patriarchy and gender-based violence, and I'm sure that there are many people on this call far better placed to be able to speak to it. But if we start to look at the psychological factors, we know that there are societies that are highly patriarchal, but don't necessarily have high rates of gender-based violence. And so we need to understand what is mediating high rates of gender-based violence. And the meta-analysis that looks at the psychological aspects of this has shown that where you have societies where men feel that violence towards women is okay, so when high percentages of men say that it's okay to have violence towards women, And when those communities, the norms are that it's acceptable for men, that say that women must do what men want. So those two factors, violence is okay, women must do what men want. That has an extremely high association with gender-based violence. So entitlement, and those two factors, entitlement is a major, major issue. In South Africa, how does it relate to marginalization? And the studies that have been done with interpersonal violence show that where men feel inadequate, where they, as you say, they don't have employment, then we start to see higher rates of gender-based violence. So if you like, it's the sense of entitlement on the one hand, inadequacy on the other, in the context of heavy drinking that ultimately pushes men over the edge. And it's really those factors that we need to deal with, both the normative factors as well as the structural factors. And then obviously getting to young people who are 10 to 14 years of age, because that's a crucial age for norm formation and starting to address those power differentials right early on. Thank you very much.
Thank you very much. I really want to just thank this panel, and we're not sending you away at all, but just to say that this has really been so useful to have such wonderful and strong inputs, and I think we're beginning to see what could start shaping a real program on this. Minister, if you agree with me, that there's been quite strong inputs. We're not done yet. We're going to have an opportunity to continue this conversation right in this session. We deliberately actually agreed, and I don't know how many of you have the time, but we agreed to extend this session until 2 p.m. to give us the time to have the conversation that we need to have. But I think to be able to do that, we're going to need to take a health break in a moment. But I just wanted to really just thank the inputs and to say that we will be able to share the presentations so that we all have the information. Dr. Mwangi has put the link in the chat so you can take a look at the Safer campaign and as a framework that was shared. And I think we'll get some of the other presentations that we can then share, and we'll come back to some of the many questions. Mabatu, let me come to you. Yes. Thank you so much.
Very much, and thank you very much. I mean, we really had a very informative first session, and I think a lot has come out in those researches. And I think, as you are saying, we are looking at going forward. How do we bring all this together to come up with interventions that are going to assist us in addressing issues of alcohol abuse and gender-based violence? And I think one of the questions that the minister was asking, are we saying alcohol is responsible or patriarch? Because there are a lot of intersectionalities around what's happening on gender-based violence. Now, before I think we still are in the first 3 hours that we had before, and I think I want us now to continue with the discussion and to give Heidi Bartis an opportunity now. We've heard from researchers, we've heard from health professionals. Now let's give an opportunity to the industry, because at this point in time, the industry is at the firing line as we speak about gender-based violence and alcohol abuse. It's like the industry is the firing line. So let's hear from the industry. It might be also in response to what others has already said, but also in terms of how do you see your product and how the correlation that has been shown, and what will be the intervention from your side. Heidi, can I give you now the opportunity to represent the industry?
Thank you very much, and good afternoon, colleagues. This is certainly a very, very important discussion that we are having. And first of all, I would just like to thank you for the invitation to be a part of it. My role at SAB is Corporate Affairs Manager for Communities. And this portfolio specifically focuses on the reduction of harmful use of alcohol interventions. So having been exposed to the industry for over 10 years, this is something that we welcome, to engage and to be a part of the solution. So in terms of the South African breweries, I would just like to mention that our company has been part of the South African fabric for more than 125 years. And this has been in various ways. So our commitment to responsible use of alcohol, communication, programs, interventions, the employment of people across our supply chain, and various women empowerment programs that we have launched over the years and have executed on. So what are we focusing on within this communities portfolio within SAB? We have a very strategic focus on road safety. So we commit to curbing drinking and driving. And how do we do this? We do this via our alcohol evidence centers that we have established in major parts of the country. Those are done in partnership with Department of Transport and with the RTMC. We also fully support, as SAB, the BAC 0% policy. And we have made our willingness and openness public knowledge to work with Department of Transport to help them expedite this policy. Further, colleagues, you know, with regard to awareness, we have taken the stance of have none for the road. And this we have put on some of our trucks as well. And there's more work to be done around this. We have also done work in prevention of underage drinking. But we know as GBV, this is a complex issue. So we've worked with the Department of Education, Social Development, we've worked with SANCA, we've even worked with NICRO at some stage to reach learners and communities. Now, all these programs that we are investing in and executing is firmly aligned with SAB AB InBev's global responsible drinking goals. And this was launched in 2015. So we're investing in social norm campaigns. In other words, we're looking at social norms campaigns that can change behavior. We have a target of 20% of our portfolio to consist of low and no alcoholic brands by 2025. There is still a long way to go. We're standing at 8% currently. There is a way to go, but we are working hard at it. And many of us know the brand Castle Free, and that is what we are paying a lot of attention to now, because this is very important. It's a very important category for reducing the harmful consumption of alcohol. We're also looking at health literacy that we want to amplify. And then in terms of our city pilot projects, and we call it city pilot projects, but it is identifying one area within a city, which we have identified as Alexander in Gauteng, where we are executing various interventions to reduce the harmful use of alcohol, including a measurement of SBI, screening and briefing interventions. More importantly, you know, we are absolutely committed to working and partnering with government and civil society in addressing these issues, specifically also looking at GBV. We are deeply concerned about gender-based violence and femicide. And also at the same time understanding that this is a complex issue It's a sensitive issue. And we have taken the brave step as a company. You know, we're the first alcohol company and who has aligned an alcohol brand with such a sensitive issue in our community. And here I talk about the no excuse movement. And we all know that this movement is linked to our Black Label beer brand. But this movement stands for positive masculinity. It was launched in 2017, and the strategic priorities for us there, first of all, when we started, was to shine a light on this issue through media, social media, traditional media, then to provoke action, and then thirdly, to commit to the cause. In other words, working on the ground, and this we do with partners. We do it with Lifeline, we do it in terms of the counseling, we do it with Father the Nation, who has workshops with men on the ground in various communities across South Africa. And we measure the calls that come through to Lifeline, which is now a WhatsApp line where the victim can send the word brave. On this line, it will be then received by Lifeline, and it will be, the victim will be connected to a counselor. Thank you, Soleka. I think Soleka has just put up on the screen the 3 strategic priorities for us, which I have just alluded to. So shine a spotlight, leverage the national scale and media awareness of Calling Black Label to present the message that there is no excuse for women abuse, provoke to action. And this is during relevant times of the year, we would put the spotlight on it, but we have come to realize this is 365 days a year. It's not only a 16 days of activism time. Then commit to the cause on the ground which I've already mentioned. Colleagues, having said all of this, we are here to open ourselves up to solutions, discussing solutions. We are hard at work. We believe in evidence-based programs to be implemented. We believe in impact assessment, which is crucial to see whether we are successful. And we work with various partners on various interventions. And this is why we're here. We want to work with everyone, to civil society, government, NGOs, to understand what is the best way forward and how we can assist. Excuse me, there was a question around the measurement of responsible consumption. Now, there is obviously a very complex formula that can be used. We can also look at what is being prescribed by various associations in terms of the grams of alcohol that you take in, how many units for males and females that can be utilized responsibly with over a period of a week or 30 days. But also if we look at the legal driving limit, which says that it has to be less than 0.05 gram per 100 milliliter of blood and less than 2.24 milligrams for 1,000 milliliter of breath. So either when your blood is drawn, that is the limit. If you're over that, you're over the limit. And if your breath is taken via a Draeger, a evac machine, the Draeger breath evaluation, you should not be higher than that prescribed prescribed per 1,000 milliliter of breath. So those are indicators that one can use in terms of what is responsible consumption. Thank you.
Okay. Thank you very much, Heidi, for the presentation from the industry itself, and also that you indicate that you've opened yourself to come and in this dialogue, so that ultimately we as a country come with solutions that will ultimately protect women and children from people who abuse alcohol and end up with us having these shocking numbers on gender-based violence. I saw Rakhadi indicated that there will be questions that are coming for you. I'm looking at the chat. That can we have a stretch? Remember in the beginning when we started, I indicated that Minister and other people have requested, because they've got other meetings. So I wanted them to hear everybody before they leave. And we only have two speakers. So if you can just a little bit plead with me that we get Nunu speaking and the he for she, then we can have a little break and have discussions. Can we do that? Okay, Nunu. Now we're going to hear from Nunu from Northwest. Oh, Heidi, I see there's a name.
Yes, I would just like to introduce my colleagues on the line as well. I am joined by Ms. Nkuna, Pamela Nkuna, and if there's any additional information required specifically on the alcohol evidence centers and its successes so far, that we can look into that in terms of drinking and driving. And we also have our CEO of the Beer Association on the line with us, Ms. Patricia Pillay.
Okay. And Zoleka?
Zoleka has also joined us, yes.
Okay. Thank you very much. Okay, now can I call Nono Ramukoka from Northwest, who is a survivor of gender-based violence in a relationship with somebody who, when they are drunk, they abuse them. So Musa, can you unmute the... Shalen, can you assist in unmuting Musa?
Yes, Mabata. Yes, Mabata. Let's just try for Bosa to unmute on her side. She should be able to.
Yes.
Yes, I
There you
did.
go.
Thank you.
Thank you.
Ke a rata go dumedisa everyone. Nna ke tlo lebolela ka botshelo ba me bo ke bo phetseng le my boyfriend. Ke motho o ne le gore ene ga ana modumo ga ana ntwa, but mare only if ge a nwele nnotagi ke fo a simololang teng ntwa. Re ne re ka phela botshelo bo bo telele nna le ene, but problem e nnile fela biala motho o innocent o supportive ka everything. So I end up laying charges against ene, cause ke bona gore e le motho o sa batleng go change. Ka the same month last year February, ka di 10 tsa February, a dira ya ntlha a ba a ipueletsa e le di 17 gape a boa. And ke bua bjalo ka motho e leng gore now o mo parole botong gona mo South Africa mo Rustenburg ko mo Hwase prison. So ke rata ke re mo rona basadi a re ska tlheleng re letla se se diragala mo rona gore mang o go lebeletse mang, but mare your happiness comes first. Ke a leboga.
Okay. What Nunu is saying, she was in a relationship with her boyfriend, and the way she describes him as the sweetest person when he is sober. That when he's sober, you not even think that he'll hurt a fly. But once he gets drunk, he would beat her up. He has been doing it. She has already opened a case against him. And what is also most disturbing is that the boyfriend is somebody who sits at the parole board. So you can imagine if he's abusive himself. So it means people who are perpetrators on gender-based violence in prison will be paroled soon. So she really is saying she has seen the impact of alcohol on her partner, who, when he's sober, they can engage, they can do anything, but once he gets drunk, then she becomes a punching bag, because then he becomes something else that they can't even explain. So she's now pleading to women broadly to say, once you are beaten, don't think about what people are saying. You must immediately take action, because it's about your life. Thank you, Nunu. Can we then go to the he for she champions? These ones that now work with men at taverns, at places where we're saying this is where men are. This is where they have given themselves the responsibility, the Catholic Bishops' Council, to work in those areas. Can I call, they're going to share the minutes, Mr. Joseph Masilo and Bishop Palani. So who is starting? Is it Joseph? Just to share with us, or is it, around the work that you do at taverns and how that intervention is giving us results that maybe can be taken to scale as we implement the National Strategic Plan on Gender-Based Violence and Femicide. Can you unmute yourself? Or Shalen Ovia assist them in unmuting themselves? Shalen?
Okay. Hi, thank you. We've got it on now.
Thank you. Yeah.
Yes, good day. Okay, my name is Joe Mashilo from Klerksdorp. So I work for the organization called the Catholic Justice and Peace Commission of the Catholic Diocese of Klerksdorp. So we are a community activist working in partnership with tavern owners to end gender-based violence and alcohol abuse. So Professor Kezi, I know her very well. We've worked with her before on research projects. Yes, we've worked with her before on research projects. And I would agree with her when she said in her presentation that communities are suffering from a dominant drinking culture and binge drinking. Yes, but what I know is that unfortunately, in my own experience, as a person who is on the ground, who is amongst the people in the community, is that also according to my own observations, that it's unfortunate that most of the people would tend to stop drinking only when they are too much drunk. When they are too much drunk, or only when the money is finished. That is the reality that I've observed throughout the years. We are also suffering a situation where we have drinking places all over the place, all over the area in our communities. We have lots and lots of taverns. We have lots and lots of bottle stores. Also the illegal shabins, because it is very easy for one to start an illegal establishment you can only start by purchasing one case or one crate of beer, and you are already in the business. You are already an illegal shebeen. And then as time goes on, you will gain the momentum as the business grows. You become you begin then to think of becoming a tavern. And it's unfortunate also to say that in the reality, it's a fact that most of the people or those who are taverns, they will know already what is the route. Most of them have started illegal route. They've started as shebeens, and as time goes on, they progress to become taverns, or they is. But now there's a difference between taverns. There's a difference between taverns. There are some drinking places are not safe spaces. They are not safe at all for one to go there, and they are very risky, or if not dangerous. Some of the taverns, and that's where you will find situations of violence in some of the taverns. But this depends on the tolerance of the tavern owners. Some of the tavern owners are tough. They don't tolerate things that are not rightful, and then they will put their foot down and make sure that their spaces become safe spaces for people to come and drink. It depends on the tavern owners. Some of the tavern owners, you will find that they too are also dodgy. Like for instance, they'll sell drugs. So what do you expect for a tavern owner who is licensed to sell alcohol, but at the very same time selling drugs? You see, that tells you what type of a person he is or she is. She's irresponsible as a trader. And then the SAPS, for instance, is aware of taverns that are safe in the community, and those that people would prefer to go to. And they are aware of those taverns that are problematic or that are not safe. And then that is why each time when they do the routine or the patrol, they would target those that they know that are problematic, and then they leave out those that are doing things in a rightful way or are within the framework of the law. So the problem of the police when they do their work is unfortunately that they sometimes having a problem of resources. For instance, they will have problem with resources like their vehicles, shortage of the SAPS vehicles, and then the shortages of the police, their staff themselves. Those are the issues, that the challenges from their side. As we sit in meetings with them in the police stations, those are the issues that are coming out from them. Taverns, as we said, there are these public social spaces. We found them that they attract a lot of men. Men find taverns to be attractive spaces, and they become so much when they are in spaces. So that is when then we said, can't we use taverns as a leverage, places that we can find a lot of men, as we would want to address the problem of gender-based violence. And so since the year 2014 in Klerksdorp, we've then structured what we call community dialogues. And we've used taverns as an entry point, and then we've had discussions with the tavern owners to say, can't you allow us to come into your tavern and you as the gatekeeper, so that we can gain access to your patrons and engage them into dialogues, into discussions, to talk about issues that relates to gender-based violence, and also issues that relates to alcohol related harms. And at some point, we also did work around HIV and AIDS, because we are aware that there are a lot of things that are happening within the taverns, especially when people are drunk. So we then said that through working with the tavern owners, that we would want to actually challenge the behaviors and the attitudes of men as we engage with them into these dialogues, so that we create safe spaces for them, so that they can be able to open up and have because in most cases, men will bottle up some of these things and not talk about those issues. So through this, we wanted to make sure that we create a safe space for them, because taverns are tricky spaces for them, just where they are comfortable. And while they are drinking, we can have this chat, talk about these issues. So we'll have a variety of topics. For instance, one of the topics that we used to do is around the issue of mavoso. Mavoso, it's when, for instance, people will go into taverns and then they will agree with a woman to say, if I buy you some drinks and if I buy you some food, and I will make sure that I take care of you. But at the end of, when the tavern closes at around 2:30, I go home with you. But part of the agreement will say, as part of the mavosa, will say, when we wake up in the morning, you'll have to give me some sort of cash as a token of appreciation, of saying that thank you, we had a great time. So we are having discussions around that with men, because of sometimes when a promise is broken, then a woman will cry rape. Will just go straight to the police station and open up a rape cases. So those are kind of kind of dialogues that we are engaging men with. So we are challenging these toxic masculinities as we engage with men and work towards replacing the toxic masculinities with the positive ones. So we've agreed to say this is our model, and then we refer to taverns as sites for change, critical sites for change. So we know that in most cases, these taverns, people will paint a negative picture to say these are the problematic places which are creating sorts of problems for a community. But with our model, we are saying taverns are the critical sites for change, because that is why we engage. Because we want the community to view taverns differently. We are also encouraging men in taverns to stand up themselves and become activists, because of when instances of sometimes you find that rapes are happening after the tavern, late hours. So the following day we hear of stories of rapes and all that. So we are encouraging men not to say that whenever they hear of such stories or such cases, they too stand up and denounce such actions, and they will, because previously we used to go to the courts and picket at the courts. So most men we used to work with them around those activities, and they supported. And then to a point where in one of the extensions in Joburton, in Klerksdorp, a group of men there started to organize themselves to say that they want to open up their own organization, which will deal similar with what we are doing, but their main focus was to actually root out the drugs, especially among the young boys. So we appreciate what the initiative that they've taken. It is as a result of them attending our dialogues. We have learned through the COVID-19 that when the alcohol is not there, so there are incidences, crime statistics, particularly around issues of sexual violence, crime statistics around issues of car accidents and killings and all these kind of things. They dramatically went down. It was a proof that when alcohol is there, we experience this kind of problems. But what surprised us in Klerksdorp is that gender-based violence kept on going up. It kept on going up, and then we started asking ourselves questions that, why is this happening? Because we know that the alcohol is no longer there, especially in major retailers like bottle stores and all that, and taverns were closed. But we knew that even if taverns were closed, but illegal, some of the tavern owners those who are not respecting the law kept on selling. They closed their front doors, and they opened their back doors. So they engaged into criminal activity of not respecting the law. And then we're very worried about that. And then also what I've observed through the COVID-19 is that people have demonstrated to us that we truly are suffering from a dominant drinking culture as a nation. People demanded alcohol to a point where some of the liquor stores there were house breakings and all that. So people were showing us that we are not a country without alcohol. And then there's also an element around this, the issue of, or an element of homebrew alcohol, because of most of the people opted, or most of the people found no option but to go to those bargaining community or a livelihoods way of making themselves alcohol, and they kept on drinking their own brew, and which is one of the elements which is mostly neglected. But what I can say is that most of the people in Joburg and around during the COVID-19 were consuming home brew alcohol in high volumes, and then that element we need to take a little bit of attention around it. So we've seen a change around men, in particular, as we engage with them, and we are very much pleased to see them standing up and taking their own initiatives around, because they are also giving us testimonies on their stories of change whenever we engage through this. So I will keep it there and then say thank you very much.
Thank you very much. One of the things that I heard that, oh, Bishop, yes. Okay, I thought it was done. Can you continue?
Okay, I won't take long. I gave my brother a bit more time because he's really actively involved in this project. But as part of our contribution to this issue of alcohol and substance-related violence, the Taverns Community Dialogue, which is being conducted by the Justice and Peace activists over the past years, have contributed to the following findings. Number one, participating in our tavern intervention programs has alerted men to risk sexual behavior and gender-based violence, including rape, associated with alcohol and drug abuse. Our Justice and Peace activists are educating patrons about the abuse of alcohol and its effects, especially in light of the strong correlation between harmful alcohol abuse, gender-based violence, and then HIV and AIDS, as Joe mentioned. Participating taverns in this project, in this He for She project, have become healing spaces for men where they are sharing their struggles, challenges, and learning from other participants on how to overcome those challenges and problems. Thirdly, the dialogues have shifted men's perception and actual consumption of alcohol from abuse to responsible drinking, such as drinking alcohol at the taverns in reduced to maybe Sundays or social entertainment activity. We are doing this because we believe that men can change. Men are being able to, are involved in changing hierarchies at family household levels as responsible partners and fathers. We are continuing to see men who are seeking help from their drinking problems, and we are working with other stakeholders like Sanka to assist them. Men who change values, they begin now to value their deepened relationships with their children, their wives, sisters, and new friends. Men who change become champions of change for others. Groups of men provide a platform of mutual support and for further community action to set new gender norms. And finally, men breaking the silence. All men are not discriminating and violent, and we have come to experience that through our interactions. Through this work, we have seen many who are involved in dialogues, condemning and challenging their counterparts on gender-based violence. In our recent past, we have even had them joining in the protests at courts whenever there are rape trials. So it is a project that reaches out to men It is a faith-based kind of project, reaching out to men in the taverns, to dialogue with them, to assist them to see the dangers of alcohol, the danger of alcohol abuse, and also to teach them to take responsibility for their behavior once they drink. Thank you very much.
Thank you very much, Bishop, for the work that the Catholic Bishops' Council is doing. And as part of, look at how Anne is happy. You know, she
no, the bishop is such a soldier for this work. I'm so happy to see him and to hear him. So
yes, and Minister, of course, because you are her bishop, she also is very, very happy. Yes, I think we now have, this is now the intervention part, and the questions that needs to come, we now have to bring this to what can we do collectively as a country to now intervene in ensuring that there is reduction in alcohol abuse, that women in their homes feel safe even when their partners have a glass or so. The focus that we have on the NSP that has been lifted up is around prevention. We're saying we need to prevent gender-based violence even before it starts. Because at this point in time, we are busy with reacting. We are reacting after somebody's in hospital, reacting when somebody is dead. So we want to have programs that targets perpetrators, that changes behavior, that we do not have any man who thinks that abusing a woman makes him a better man. So the toxic masculinity that the church is dealing with, the traditional leadership also, we including them in that, to say institutions that entrenches all these toxic masculinities, we have to deal with them. And any other thing that is a driver, we have to engage, hence the issue of alcohol that we've engaged today. So I'm going first to look at the chat if there are questions. We got an apology.
Minister has the first question.
Yes, Minister.
No, I'm very sorry, Chairs. I really did not mean to be rude to your good selves, but I'm being harassed into the next room for another meeting, which is equally important. But I really thought I should take this opportunity before you get into the real discussions to thank my bishop, Bishop Palan, and the gentleman who's accompanying him, but also say, hey, I got a little bit worried when I heard that taverns are still allowed. I don't know whether you were saying they're still allowed to go on and open until 2:30 in the morning. In COVID, President has made a pronouncement publicly that the curfew time starts at 10 and 10 to 5 a.m. So I think we should stick to that. Number two, we must, in this beautiful initiative that we have started, we must also be emphasizing where men gather, because you are able to access them and teach them the good norms, good Catholic norms. Please also talk to them about respecting the protocols of the WHO on COVID, because we really have buried enough. We don't want more. This one of taking girls because somebody has bought a bottle of whiskey or something until 2 a.m. in the morning, and then they can do a sleepover. I thought in the Catholic Church we don't have sleepovers until marriage. So I don't know. I don't understand you. I don't know what you were saying. I'm not asking the bishop. I'm asking you, because it's you who said that. And I think even in African culture, not the patriarchal one. This one, Wadima Musadi for the night because you entertained her during the day. I don't think that's what we want to encourage. So I thought this maybe we need to look at. Generally, I also wanted to acknowledge with happiness the presence of the chief whip of the ruling party, Mayor Femicide. And having said that, I've also listened to contributions, even from the ones from the SAB, that we are all about behavioral change. We really cannot be number one in this worst thing in the world, number one in this worst thing in the world, and end. In this country, a few months ago, we launched a program of a district model of development. So if you have a way, the church in Klerksdorp, to link this with the municipalities, I think you can reach out to more than just Catholics. I agree with those who spoke before me, particularly the researchers, that bylaws are not working. That's why people open taverns forever. They know the opening time, but the closing time, they don't know. I think our bylaws must bite so that people must respect the law. And I agree with SAB that you are going to also look at reduction of alcohol content. This issue about patriarchy and masculinity, it's not a creation of young men of today, but it is a problem. It is inherited, as I heard last night from an elder, a woman, that we carried it from apartheid time. This time around, we want free women. When you say free, we mean free, who will be associating because they want to associate, but that they are not attachments of so-and-sos, but also that they are financially free, that they have access to finance. So therefore, in this August, as we celebrate the Women's Month, generation equality will become a reality. I thank you.
Thank you very much, Minister, for your inputs. I did apologize at the beginning that you have other meeting, and I'm glad that at least you had every speaker that was going to present. Madam Chief Whip, do you want to say something? Mampeni? Shalen, can you please open Mampemi Majodini's? Thank you.
Yes, I'm unmuted now.
Thank you, Chief Whip.
Thank you very much, moderators, for this powerful session.
Is that me or we're losing her?
You're losing me.
It's on the website, yes. Perhaps close the video.
You are fine now. Can we, yeah, maybe close the video, yes, maybe close the video.
Chair?
Yes, much better.
Thank you very much. Let me first start by appreciating all the presentations. They were spot on. I think what we must do as an urgent task at hand is to re-engineer new socialization method of South Africans. How we socialize, how we do things need much to be desired. If we do introspection, we were not born violent, but the circumstances and the environment which we grew up in made us to be this violent society. We became extremely violent when the regulations on alcohol were not very much limited. I think there is one or two things that we can learn out of the COVID-19. With the restrictions on lockdown level 4, level 5, level 3, we've seen a change of the mindset. The positives out of that is for us to regulate the selling of alcohol, who must access alcohol, and also I was happy by the presentations that were saying must also limit how much can one consume or be allowed to consume per day or per week. I think if we can take those positive spin-offs that came out of COVID-19 regulations and lockdown, we can see the country going forward. But we need to build a nation which respects its values. You cannot have a nation that is based on alcohol, certainly, and abuse of women and children, gender-based violence and femicide. It is in the mindset. I don't really fully believe that alcohol 100% it does impact to the bad behavior. It starts with you in the mindset. Alcohol make an additional source, sort of an energy for you to do whatever. It needs us to change the mindset of people on how they look at women, how they look at society. Therefore, the behavioral change is what must happen. I'm happy that the industry is here. The industry is here, and the industry is saying we have campaigns. We're working in partnership with other departments that of responsible drinking. I think what becomes the weakness of the responsible drinking is that there is no monitoring of that responsible drinking. Hence, the earlier presentations that were saying we must limit the sale of those consumables to South Africans. We can turn the tide around, but also, Chair, how do we strike the balance between this responsible drinking, regulation of operating hours, as well as job creation and job savings? I think what we're supposed to do, we must work out a clear plan to say, if we are to save jobs, but at the same time we allow people to consume a liquor, how do we work this together? Where do we bring these to an area of convergence? And that is possible. For the mere fact that you have the religious sector here, you have, I think, the missing link. I've seen Unkosi, Umafaku, I've seen Unkosi here. I think the traditional leadership was supposed to be part of this webinar. The municipalities, with those who are supposed to enforce the bylaws, were supposed to be part of this webinar. Maybe the way forward should be that let's cascade these webinars down to a level of locals, because that is where these things are happening. That is where a lot of GPV is happening, and we can be able to reach our goal in terms of not reducing but eradicating this gender-based violence. All the presenters were spot on, and how I wish we could have maybe a small team, a small team that will lift all these presentations and try to make a clear action plan. Come 2021, when we come to this webinar, we should be saying, what is that we have implemented from 2020 to 21? How are we? How did we positively impact out of the presentations that were made in our quest to eradicate this misuse of alcohol and gender-based violence? Thank you very much.
Thank you very much, Ms. Pemi. And I think the DG in the way forward, you've already suggested one way forward in terms of having a clear action plan on how we're going to implement resolutions that come from this webinar. So I think Joyce in her way forward will incorporate all that in her presentation. I don't see any more questions. I know it's comment. I see Heidi. I'll come to Heidi. Richard, I'm so pleased we can count on SAB support for ensuring WH best buys are expedited, which is increased excise taxes on alcoholic beverages and act and enforce bans on comprehensive restrictions. Now, why isn't it open here? Heidi, let me give you an opportunity, and then I will go to the chat. I agree with Mama Todina. There's a lot of agree with you, Mama Todina. Yeah, let's give Heidi an opportunity.
Thank you, Ms. Mphato. I actually wanted, as part of the way forward, just ask Zoleka if she could quickly just share the focus of the industry, because I think that is imperative for moving forward collectively.
Okay. Zoleka? Can you open Zoleka, please? Shalen?
Hi, yeah, you should be able to now.
Okay. Try on your side, Zoleka. Yes.
Yes, I'm now able to. Good afternoon, colleagues. Firstly, thank you for creating this platform to have a much needed discussion in our country. And I think the timing is just ripe. I'm just trying to get a hold of the presentation so I can share. If you can give me a moment. Can everyone see my screen?
Not yet. Yes, it's coming.
I think one of the things, as not only as SAB, but as a broader industry, is to Heidi's points earlier, is we really do understand that we have some serious social ills that need to be tackled in the country, but we'll only win if we work as partners. I just want to share briefly some of the areas as an industry that we're thinking about. And I think for me, this is a great forum to build. I'm not coming here with all the answers. I'm coming with our thinking around the solutions based on engagement with a number of social partners, including government, other players in the business and in the industry, NGOs, even our own unions and the like. A big priority that we are wanting to tackle, not only through the legislation that we support of a 0% or reduced BAC, but is around this notion of equipping law enforcement. So as breweries and as the industry, we're committing to establish alcohol evidence centers that gives law enforcement the tools to ensure that they can test. However, we need to continue to work that throughout the entire value chain, when someone is caught drinking and driving, what then happens? There's a lot of insight we have around the bribery in the value chain, the length it takes to prosecute and the like. So we're already brainstorming around partnering with justice and police around tightening that area. We really do welcome any partners on the call who've got ways, ideas to enrich this. This is a key priority for us as an industry. Secondly, I've heard questions around, do we measure programs, and how do you measure responsible consumption? When we design and scope a project like an alcohol evidence center, it must be outcomes-based and evidence-based. We need to ensure we've got a data management system of sorts. So with the AEC, Heidi and the team and Pam have ensured that we are capturing data. So in a specific area like Pietermaritzburg, for example, where we've got an alcohol evidence center, we are tracking the movement around of cars. We are tracking the number of road fatalities, the number of fatalities linked to drunk driving, how many prosecutions, etc., etc. This allows us to understand how to improve. So data-driven decision is everything in terms of how we design, shape, and monitor evidence-based programs. When it comes to underage drinking, as a mom of 3 children, there's no excuse. And as an industry, we are really trying to really think hard around how to remove the scourge that we see in society today. One of the ways is to really make it difficult for young people to access alcohol in this country. And one of the ideas, and I've seen it being shared, I think, amongst other partners on the call around implementing simple things like an ID verification system. We need to make it very difficult for young people to walk into any place that they're not meant to be in to access alcohol. And then we've got a number of programs we've thought about. So I used to run entrepreneurship programs in my past. We need to give young people alternatives to be busy. We need to make sure that we're keeping them positively productive, not only in schools, post-schools, and the like. So when we look at the programs we design, we look at how we are preventing, making it difficult, but young people want to be kept active and busy. So there's a number of things we're working with a number of NGOs to say, what do we do with our young people so they're not loitering on the streets and have nothing to do? And for me, I think a big thing we need to tackle, not only just as an alcohol industry, but as a society, is education of our young people as well as employment. Young people need to be kept busy to make different decisions. I've touched a little bit about gender-based violence. We are working with very well with the Department of Social Development, with our colleagues in Takwani representing the men's sector, with giving trying to drive positive male masculinity. And I know there's a lot of discussions around brands and alcohol brands playing in this space, but to have a beer brand that says you will not drink our products and behave in this way is maybe one of the ways we need to think about changing the voices that brands play in social movements. So calling Black Label is speaking about tough things. And you know, in our society, we've gotten accustomed to maybe speaking behind corners, but this brand must come out and say, we've got a problem. These are some of the things we can do about it. We've got a WhatsApp line that we are tracking every day with the number and type of calls that are received by Lifeline. We've got data that is shareable with the group. We have shared some of the information with the Department of Women and Ministry, but there's so much work in this space. I won't lie, very complex, lots to be done. I think as partners, we need to look at what role we can add in different, as different role players using the skills, the scale, and the tools we've got at hand. And then lastly, binge drinking. Consumer education, I think, is very important for us as a category. We need to ensure we drive our consumers to drink responsibly. And I think we mustn't underestimate how much education is still required. And that speaks to some of the work I think my colleague shared on the group around social norms marketing. As a beverage of moderation, we are continuously trying to encourage people to drink responsibly in a number of ways, various occasions. And that's important so that as people grow up into young adults, they're seeing positive role models and are making different choices around how they consume. These are just very, very high level summaries, just to give a taste to everyone on the call around how we, not only as SAB, but as a broader industry, are thinking about these challenges. And I think for me, my challenges to all the partners is we need to start building. It's come to a time where we cannot talk across the table from each other. So as you see the industry, if there's things that you feel we could be doing better, let us form this team to really enrich how we can roll up even programs like this that the industry is now working on. Thank you very much.
Thank you, Zoleka. I've gone to the chat, and the first one that comes from Richard. What Richard is saying, consumer education campaigns are known not to work in the context of binge drinking. That is, it does not appear among WHO's best buys. Why not focus on strategies that work, e.g. advertising best? That's number one. And the second one that comes from David, it's very important that we don't only focus on information and consumer education, but on changing influences and incentives that drive social and personal behavior. Those are the 3 I's that must shape our strategy. And then also Richard says most of the acute alcohol harms, that is violence and injuries, are most focused among young adults, not under 18s. Therefore, why don't raise the minimum drinking age? Okay, oftentimes organizations that work with, no, that's something else. I think it's not only.
There's a question about.
Then there's one that the advertising of alcohol is misrepresented. Every time someone has a problem or a need to celebrate, it seems that alcohol is a medium to address it. This is a perception that needs to be corrected. How do you correct that celebration? Then you must have something to drink. The Mavuso is a broad one where we need, I think, the Catholic Bishop Conference and other people can also answer that. We need programs in universities and schools to raise awareness on alcohol and gender-based violence. As a young person, I have noticed on how alcohol plays a major role on gender-based violence. Most men know that it is easy. It is an easy way to get young girls. And this thing that we call Mavuso, this thing called Mavuso, and young women are victims of that, which they end up being killed because they were hoping, that is men were hoping for Mavuso. And you saw another question. What is the question?
No, that was the one actually. It was the one about universities that I was.
So that the response is not only to, especially in terms of GBV and universities. So I think Heidi and the team can respond to the ones that focus on the industry, and then we'll go to the men's sector to deal with Mavuso and universities and everything else. Who will start to respond? From the industry.
So, would you like to respond to the responsible consumer education? So, can you hear us? You're on mute. Can somebody unmute her, please?
Can you unmute? Can unmute Zoleka? Shalem, thank you.
She should, yeah, you should be.
Okay, sorry.
Jeez.
I'm now I'm unmuted. I think this question was raised by Richard with regards to education campaigns not working. I think it's a provocation back to say that I think we mustn't underestimate positive role modeling and what we perceive to be social norms marketing. I think I'm not saying that there isn't more work to be done around how brands engage in this space, but I'm seeing a lot of evolution. Definitely, I can say here at SAP, there's a lot of work we are putting in to getting our brands to show up differently for not only young people, but just people across the board. So I think, Richard, to say bluntly, it's something that doesn't work is something I think that needs to be explored a little bit more and a little bit deeper around the role brands play in terms of educating people around how to consume and portray positive alcohol consumption. And we've been spending a lot of time not only working locally but with global advisors across different fields to really crack this thing around social norms marketing. Yes, there's some work to be done, but I think it's something we should definitely still explore, and our brands are taking up that voice around speaking positive behavior in South Africa. Secondly, there was another question around focusing on not focusing on underage and prioritizing raising the legal drinking age. I think it was again raised by Richard. We did a pilot study along with our partners as well, aware.org. Let us not be naive and turn a blind eye to some of the activities taking place in our schools with young people making poor decisions around alcohol, where we've got feedback from young people who are partaking in the category. It's not okay. And I think to then move away from that and focus on a slightly older group and leave some young people to make poor decisions, I think is something that's a big oversight, not only as an industry, but I think as broader partners. So I think, Richard, I think it's something we need to tap in, and maybe we can share what we're finding with yourself so that you can understand why it's important to focus on under 18s. Thank you.
Are you able to answer the question, why not raise a minimum drinking age?
Unmute.
So you can't unmute yourself at all. Shalen, can you remove?
Pamela is able to unmute. She's in control.
She's struggling, she can't. I don't know why.
Try again.
Helen, it's for Zoleka. Zoleka needs to be unmuted as well.
It's Zoleka that needs to be unmuted, not Pamela. I think for me, it's that one. Why not is the minimum age and then the ban on advertising? Those two. I didn't hear your response on what the question came out on that. She's still muted.
Yes. I'm unmuted, sorry. After I speak,
Yeah.
I go on mute, and then I think I lock myself out each time I do that. And then Chair, my response on the raising the legal drinking age was to say, I think it's so important to not overlook the under 18s. And I think we've got scarce resources in this country. We need to make sure that there's a lot of activity that we are getting, even some of the research partners that are helping us, giving us insights into what is happening in the under 18 pool. And I think for us as an industry, we are highly focused on ensuring that you stop it there, where you've got people who are 21 who can run businesses, get married, do a number of things. But if you're moving away resources from a scarce resources from a pool that's already not getting the right attention, I would challenge that. And I think it's something we must think about quite carefully and the implications thereof. But I think it's very, very important that we don't lose focus on the under 18s with regards to the legal drinking age. So as an industry, we don't support the lifting of the age, because we're going to be taking what already is not being focused on and spreading it into how to explain it, using scarce resources to cover people who are maybe older adults. And maybe we should think of what are the right strategies that need to be used to tackle the over 18s.
Okay, and then the advertising ban.
And then, Chair, I think again to my point around we need to have a deeper understanding of the role that brands play in driving positive role modeling around specifically how to engage with the product. We've got our own self-regulatory code around what it is brands need to do differently and better. We've been investing a lot. Chair may say we're not necessarily there in many respects, but it's a move to say these are brands that speak to people in a way where we're needing to drive different behavior. How do we get brands to play in the role of social norms marketing? In many of our peer countries that we're looking at, it's something that is is becoming an important tool. For example, no alcohol beer. We would use the brand, an advertising and marketing education platform to say, do you understand that we now have no alcohol beer? And what does that mean? How do we try and gain momentum around a new category that I think someone has spoken to about the changes we've seen in the UK and the introduction of non-alc in that category and what it's done to the responsible consumption changes. So the brands can play a very important role around social norms marketing, but we need to abide by the marketing codes and be held accountable to be doing the right things.
Okay, thank you. The Mavuso issue, the Catholic Bishops Conference, Bishop of Joseph? You also want to, okay, yeah?
Yes, when I was referring to Mavoso and also our approach when we stepped into the tavern, remember we are a faith-based organization, but when we got there as an organization, as justice and peace. So it will be practically difficult for us to instill the teachings of the Catholic Church about our faith, the way we do things as the Catholics, with the tavern, I mean, with people in taverns. So our approach is very simple. We keep it low. We talk community language. We don't do, but as long as, but we know for sure that what we want to achieve as a faith-based organization is to influence change, is to instill morals that are needed for as a society. So it is practically difficult to be talking the language of the church when we are at a tavern space.
So the community thing is really around addressing issues of toxic masculinity broadly, but not from a faith-based.
That's correct.
Okay.
I wonder, Sis Mabatu,
Yes.
I wonder whether or not he could answer the questions that the minister raised. There's a couple of things. One, do they experience the Mavuso phenomenon amongst the young women who go to the taverns? The other one, I think minister asked questions, and I think you just need to clarify. She seemed to have heard you say that you are, you're supporting the running of the taverns beyond regular hours to 2 a.m. What was the other point? There was a second point that the minister raised in response to your input. So I think you just need to clarify what is your approach to the hours, to the limiting of the hours in the taverns. And then the other one, I don't know whether you're involved at all in the Mavuso phenomenon amongst young women.
Okay, when I was talking about the taverns closing hours, I was referring to practices that are there before the COVID-19, when things were okay. So I was not making a particular reference to during the lockdowns or whatsoever. During the lockdowns, what I said is that taverns, some of the tavern owners closed their front doors and opened their back doors to sell illegally or to smuggle, but not to allow people to get in there, just for them to buy and go. So I was not referring to whatever the duration of the lockdown. That was prior. And then with regard to the young girls around the issue of Mavoso, it's happening. It's happening. You will find the young girls there at the taverns. So it's not different, particularly from the older ones. So it's happening. The young girls and older girls are not. There's no difference. It's happening.
Okay. There's a question to Zoleka, Heidi, and Pamela. Are there plans to make?
I wanted also to emphasize that it is wrong because of when we engage into topics around Mavoso, we want to challenge these notions around Mavoso. We are saying that we don't need this in our society. That is what we are emphasizing every time.
All right. Okay, the question is, are there plans to make 20% of products low or no alcohol, just about launching new brands? Or would you consider reducing the alcohol content of existing brands, for e.g. Black Label, in order to ensure greater impact rather than having to shift buying behavior?
Can we just unmute Zoleka again, please?
Zoleka, you must
To
leave
answer.
it. You must leave it on. Shalen, unmute Zoleka. You must just leave it on, as long as there's no noise behind you.
Okay, I can do that. Thank you for the question. I think when we're looking at the 20% target, it looks at a number of things. It looks at new products, existing product innovation and the like. So in order to get a 20% of our beer volume to come from no or low alcohol, we're applying different levers. So it's not only new products, it's also looking at existing product innovation to see how we can continue to lower. Look, there's still some work we need to do in this space, but we're definitely looking at existing portfolio and if there's opportunities to look at ABV optimization in those spaces. I hope that answers the question.
Hope so too. Prof. Kezia, you want to make an input around the taverns?
Yes, thank you, Ma'am Mabato. I just want to clarify some of the things that were shared by Joe, especially with respect to the questions that were raised by the minister. So what Joe was saying in the context of operating hours is saying as part of the intervention, these were some of the key findings that emerged from the research, that prior to the intervention, it emerged that tavern operators or tavern owners were operating beyond the 10 p.m. cutoff time. And also the issue of Mavuso is a reality that is there, even if the Justice and Peace Commission is going in there as an organization and not as a church. This is a reality. And this is something that they've been trying to address through the dialogues with men. So it's about operating hours, it's about risk social behaviors that are taking place within the tavern context. And the Justice and Peace Commission is coming in through its dialogues to engage with men in taverns and patrons to say what can be done to reduce and address some of these issues. So it's not going in there to say let's perpetuate or let's continue with the situation or maintain the status quo as it was. But we are saying, let's look at the issues. What are the key issues? They have to do with regulations, municipal bylaws, sexual behaviors, and let's address them, have dialogue. That are not necessarily from a Catholic point of view, but just as a Justice and Peace Commission to say, let's engage with these because they perpetuate gender-based violence within our spaces.
Okay, please unmute Patricia. But I also, while we are unmuting, I want to read what Richard included here. And Pamela, I want to say something. There is a comment that says, it's a frank comment from Richard. The industry has taken a collective decision on which harms are least harmful to turnover. So in her comment says, what is expressed here reflects the position of big alcohol globally. So in South Africa, we need to set the policy agenda so that big alcohol will respond in due course in a manner which best protects their business interests. So we should not be distracted from the evidence that works, of what it works. Yeah. So I'm giving you, Patricia, an opportunity to make an input, also taking this latest comment from Richard into consideration.
Thanks, Chair. And I really want to thank everyone for their contribution today. It's been most helpful for myself as well in this industry to get my head around how we can work better together. And I think that is my general point I want to make, is that there is a lot of distrust in this industry and towards the industry. And I think that the sooner we try and drop that, the better it's going to be, because that's the only time we're actually going to start working together. Because as long as we're going to continue to not work together and question each other's motives, it's going to delay the process. And so I plead to everyone on the call to say that, yes, there is history and there is a lot of it. We carry as South Africans a lot of history, and we must not discredit that and not discredit our journey. But where we are right now is in a crisis. We all are, a lot of us here, victims of some kind of abuse in some form or the other, and we must now be able to work together. And I plead to all of us here to say that I think this forum is a great start for us to have this dialogue. And there is great evidence, there's great learnings from this. But when you look at some of the work that has been produced, it is done in isolation. So we welcome the efforts, we welcome the support to say, for example, the presentation that Zuleika has put up, to say that is our views, this is our finding. And I must add, it's not only SAB, it's not only the beer industry, this is the entire alcohol industry that has put this together. So it's spirits, it's your wine industry as well. This is what we've come up with. So we're saying to everyone, we're extending the olive branch and saying, how do you think this is working? How can it work and how can it not work? Because I can tell you the biggest learning out of COVID has been that banning is not an option. And I think also the colleagues on the call have also said that. It does not help anything. In fact, all it does is creates a further binge culture because people have missed the substance. If they couldn't get it under illicit means, then they actually were celebrating because suddenly they were opened up. Anyone deprived of anything will go on a binge after it's opened. So just to say that banning is not the way to go, what we do need to do, and everyone has said it, is change behavior. It has to happen, and it has to happen throughout the generations. It has to happen at a school level, but it also needs to go through to adults as well, to women as well, to children, and to all of us. So I really plead to all of us to say, this is a great start, and please can we continue this dialogue, but with openness, and to say, let's contribute. It must go beyond the conversation now. It must now go into the solving of to say, can this work practically? Let's bring the best practices and work together. Thanks, Chair.
Okay, thank you, Patricia. I don't see any other hands. I would, if there are no other hands, I'm going now to call, let me just check the role of government is to focus on making the big difference. Yes, the first best 5 WHO buys, we have to focus on industry behavior as much as we do on individual behavior. Totally agree, David. So I think for me, even though I'm not doing the summary because Joyce is going to do that, is that in the discussions one thing that I also heard from the Chief Whip is that we need to look at the two. We need to look at business, but also look at individuals. We look at also in government and how we ensure that we've got the right policies in place that will ensure that the expected outcome is what we all agree on. I think that I've heard from what Pemi was saying. The issue on responsible drinking, that even when it's promoted, because there is no instrument to monitor that, it becomes a challenge. And then the biggest challenge that the government has is whatever intervention that we must bring should not make people lose their jobs, because it's an issue of jobs, but also issues of protecting women from abusive, or even the nation from abusive behavior is also critical. So yes, you agree that we now need to start from where we are going forward, that we should not look at this trust that has been there before, but what is critical is that we need to implement also programs that works. So if there is research, every time we talk about evidence-based programs. So whatever we put in place, if there is evidence, let us not reinvent the wheel. Let's ensure that we implement programs that work, because for us, gender-based violence cannot take another 10 years. It's one woman abused is one too many. So we definitely will have to have but I think, I don't, let me not even go there, so that I can give Joyce an opportunity in her summing up and way forward to direct how we are going to close this. And this is not going to be the first and the last, because we want to ensure that ultimately we've got programs that works. We might want to make sure that, yes, at the end of whether it's this administration, we have seen the needle moving because of the outcome of what happened today. I think that's critical for where we are sitting. Joyce, can I give you the opportunity to make your closing remarks and way forward, the summary and way forward? Mikateko, thank you. Shall assist in, oh, she's fine. BBC.
2IR. Thank you. Again, I would like to acknowledge the minister in her absence, the chief whip, all MPs, traditional leaders, all presenters, distinguished guests, officials from government, civil society, everyone who's participating here. Thank you very much. I think this webinar was empowering. It was very informative. I think it's one of its kind now in South Africa. But also it has helped us to be able to make decisions, because I'm one of those people whom, when we start, attacking the media and, the alcohol industry, and they come back and say, no, but people are going to lose jobs, and then you run away, you think, hi, people are going to lose jobs. Today, it is, I think it has been revealed that the alcohol industry contributes 3.1 billion, and it takes away over 500 billion. And I think that is what has been costed. So as I heard the chief whip saying, we need to look to balance between the jobs and its social impact. Yes, we need to balance its social impact. However, I think it also calls to us looking at other measures, which I'll talk to when I go to the way forward. I think Dr. Matsopoulos, clarified that area of the costs. The cost benefit analysis supports the fact that we need to do something urgently. I've just heard that the ban will not solve the problem, but COVID-19 has shown that the ban had reduced drinking, and one would say others will stock a lot of alcohol, but once you have a ban, when you find that person, you can be able to arrest them. Dr. Kezia Batisai referred to the problem of students, that she had said some of the things that others have said, but she referred to the problem of students, that at universities, students use alcohol as a coping mechanism. Because of lack of support, because of many other challenges that they experience. Also, this is something that we need to look at when we look at the way forward in terms of what support structures do we put at universities. First of all, to look at what support structures exist and whether they address the issues or not, because I know that universities have all these support structures, but they may not be responding to the issues. Dr. Mondi Wangi said 12.5% per 100,000 women's death in South, or gender-based violence results in 12.5% deaths per 100,000 women in South Africa, which makes South Africa to be in the top 100 countries with femicide. This is scary. It is said that we are a country not at war. However, our deaths equate to those of countries which are at war. And then also he referred to some research which indicated that it is confirmed that most of the cases of gender-based violence recent consumption of violence would always be one of the reasons, or it would be brought forward as somebody had alcohol before he drank. And then he also indicated that even if someone is not involved in physical violence, but they will be involved in issues of coercive sex, multiple partners, and all those which are also detrimental to women's health and women's relationship. He also indicated that we need multi-sectoral approach in addressing the gender-based violence. So all other government departments, despite the fact that South Africa already is operating in that fashion, we have clusters, DGs clusters, where we're looking at a multi-sectoral approach. He also referred to access to health, that for somebody who's been raped, they must be able to get access to the PEPs, and but also medical, also psychological assistance and all that. I think all of us participated. We heard what they were saying, the presenters were saying. Let me not waste time. Let me just go straight to the way forward. What I think as a department, as the Director General of the Department of Women, as the person who also has the responsibility to take forward this webinar today, that first of all, people will get the report, there will be sharing of information. People can send emails to whoever invited them so that they can be able to get the presentations that they would like to get, if allowed to get the presentation. But also one of the commitments is that we are going to have follow-up webinars from this one, but also looking at other health impacts on women. For example, women who drink when they're pregnant. There are serious consequences where children are born with certain syndromes and all those things. I think we need also to look into that area. I think also we need to look at the regulatory interventions, as indicated when we started, that the department mandate includes monitoring the implementation of legislation by all government departments, but also recommending amendment of legislation. So some of the things that we have to look at would be the continued partial ban of alcohol sale until we have our that's in row. But also the other thing that we can recommend to the Department of Health would be like Coca-Cola. You remember Coca-Cola, they were compelled to reduce sugar intake, and it made a big hullabaloo saying the jobs will be lost, and whatever jobs were not lost. So one might have to look at how is alcohol concentration reduced, whether it will have impact or not. As it was said earlier on, that we need to have evidence, but the process will also involve looking at evidence. Also the issue of whether there's a need to raise the legal age of consumption or not. Those are some of the things that we're going to look at. Media, we are definitely going to involve media. I think it was Dr. Batisai who said media plays a powerful role in behavioral change. But also, I think it's important for us to empower the media with the right information, because sometimes if they don't have the right information, it can create problems. Also, as indicated earlier on, that all measures will look at a balance between jobs and people's health and the safety of women, youth, persons with disabilities, the LGBTIQ+, and the others. But also, I think the most important thing that we have to focus on is the involvement of the Department of Basic Education and Department of Higher Education and Training, where we have captive and kept a captive audience for about 16 years, because at basic education it's 12 years, and then when they go to tertiary it's 4 or 5 years or whatever those years. During that 16 years, we can be able to change that behavior, or we can be able to inculcate the culture we want. But also the other thing that came up was the lack of support systems in especially townships and rural areas, support systems such as the rehab centers. When people find that they are hooked to alcohol, sometimes they don't know where to go. So those are some of the things that I thought they are part of the way forward. But I think the team, because I was not able to communicate with the team to give me inputs, following this, we'll be able to come up with more extensive issues that need to be looked at in terms of way forward. Thank you.
Thank you very much, Advocate Mikateko Joyce Maluleke. We're still seeing the new DG of the Department of Women, Youth, and Persons with Disabilities. Thank you very much. And I think, as she has just indicated, this is not the first and the last. I mean, the department being in the presidency at national level, policy briefs is part of what we need to be doing. You can't advocate or lobby or mainstream or monitor if you don't engage different sectors that are providing a service that's supposed to empower women, youth, and persons with disabilities. So this is one of those things that we continuously will be doing, whether it's industry, whether it's any other private sector, NGOs, to ensure that all programs of government benefit these sectors that we have to advocate on behalf of. So definitely we'll continue working with all of you, and Heidi and Patricia will definitely again engage going forward, because for us, now, as I said when I started, that the minister is implementing, is a chair of the Interministerial Committee on Gender-Based Violence and Femicide. And the implementation of the NSP, and I hope you all have the NSP, the implementation of the National Strategic Plan on Gender-Based Violence and Femicide is one she needs to be reporting to the president on almost every week. So the prevention pillar, which is pillar number 2 of the NSP, addresses some of the things that we have addressed today around the drivers to gender-based violence. How do we ensure that we change behavior? And we know behavior change does not take a day, but if we agree and have programs, evidence-based programs that we can all implement, we can have clear deadlines on, it might not be in these 5 years, but we know that on this time, we would have 0 to new cases. So that is what we are pushing for. And we definitely will continue working with everybody, researchers, because another thing that we were doing when we were busy with the NSP is that we don't need to be starting new things. Working in silos is not helping. Starting new things when there are programs that are working, even when they might be working in a small village, as long as in that village that program brought results. What we need to be doing is to take those small and take it to scale. So that we have to continuously look at best practices and take them to scale to ensure that we finally have a country that we can all be proud of, but women can finally enjoy the fruits of this democracy. Now, with that, I am asking that everybody must put on their videos. As long as you are still in here, please open, Shalon, open everybody to be on video.
I think they can do that. Yeah, they should be able to.
Can we see everybody on video? And because of COVID, we don't see each other. We don't know who we're engaging with. So the purpose of us to be in video is just to say hi and bye. Now in our byes, we want everybody to say goodbye in our own mother tongue. Can we do that? Shala gabotse. Everybody say goodbye in your mother tongue and wait. Yes.
Goodbye.
Bye.
Bye. Thank you. Bye-bye.
Tell me and you are not here.
Relevofile.
Ah, wakwa? Ke tsona tse re nyakang tsona tseo. Bye. Bye. Thank you very much. The meeting is adjourned. Bye.
Thank you. Bye-bye. Bye.
The sun.
Want to talk to us? Okay, Bobby, literally, it's a coffee.